This conference will now be recorded.
Did everyone get the link with all of the documents?
Yes.
Yes.
I know that the minute you have to re-rotate it, but I'll try to put it back in the directory rotated. I forgot about that. After roll call, we're asking everyone, and Kevin's going to repeat this, to put their phone on mute. And if you do not want to see the, and he'll explain the camera stuff. But you can review the documentation while you are waiting. At 7:15 p.m., Kevin will begin calling roll call. I'll introduce the meeting at 7:30, but he'll begin calling roll call. Because we've asked all of the board members to log in early, make sure we're all in. And remember, if you have any background noise, please turn it off or put it on mute, please. I'm playing music in the background.
Jesús. ¿Todo no te lo quieres dar? No, no, no. No, stupid. ¿Ah? ¿De qué? Sí, honey. No.
You all look so good on camera.
Oh, well, leave it to you, Laverne. I know that.
Thank you. Thank you very much.
Okay, well, fine, so we know how you feel about yourself already.
I just had my makeup.
Hello. Hello.
Hello.
This is Vivian Doc.
Hi, Vivian. Which which one are you?
Which one am I?
Yeah, you're one of the callers. So I think you're caller number 2. Say something.
Okay.
Yep, you're caller number 2. Okay. I have to just make a note of who you are in the
okay.
yeah.
All right, Kevin. All right. This
Number
is all new to me.
Well, you're doing a great job.
Hi, Renetta.
Hello. Is it
How are you?
I'm fine.
Good.
Who's EHCAV? Is that Elmer's Hospital, correct?
Elmhurst, Mr. Rocha, he'll be right with everyone.
Okay,
Hi.
so we're gonna start our meeting at 7:30 and we'll introduce him. And we're going to make you a presenter, Kev.
Okay.
I forgot my mask.
Time. Okay.
Hello.
Hello.
Yeah, I'm Esteban Peralta.
Huh?
Esteban Peralta.
Okay.
Esteban.
I don't see you. Where are you?
On his phone. Did
Okay.
everyone?
I'm on the phone.
You remember every single day, every time you come to meeting, you get a folder. Well, you have your virtual folder. So it's through Google. So I hope you were able to access it with all the documents. Because I know some of it came through email, and it may have downloaded on your computer as a zip file. So it was all dumped into a Google Drive, Google folder.
Hello? Yeah. Nobody said anything. Whoa. Yes.
Hi.
This is Leoncio.
Oh, Leoncio. Leoncio, Kev.
Okay,
Hello?
Leon, wait, hold on.
Everybody's name. Okay, at 7:15. Sorry.
Leoncio, can you say something?
Yes, go ahead.
Okay, so you're Leoncio's caller number 4. Okay.
I'm gonna be connected by phone. I will not be connected by internet.
What happened?
My connection will be only over the phone. I will not be
Hard to hear him.
internet.
Well, this is the last time you will see me out of my home. Any other meetings that we have will be in my house. So we'll be all communicating remotely. We will have committee
Lena.
meetings. Can,
Lena,
yes?
hey Lena. Lena.
Who is that talking?
Hello? Hello?
You have to say your, yes, who is this? How funny. Everyone's getting used to using this. So
Lena.
I don't know who. Who? Oh, Jimmy. Hey, how you doing, Jimmy? I'm here, Mr. Smith.
Oh, Jimmy.
Yes,
Jimmy.
yes, this is Jimmy.
where
Who
are
is this?
This
Oh,
Renetta.
Jimmy, it's Kevin.
This is Jimmy. Who am I talking with?
25 other board members.
Huh?
25 more board members, Mr. Smith.
I can't hear you.
Ever tell Mr. Smith?
Who's calling?
This is us.
Who am I
Now,
talking to?
you're talking to Renetta.
Mr. Smith,
Who?
this is Kevin. Mr. Smith, this is Kevin Hughes. Naboa, how are you?
Okay.
Can you hear me?
Yeah, I hear you now.
Okay, great. So you're on a conference call. There's about, let's see, 5 times. There's about 20 people online right now with you.
Yes.
Okay, so you're going to hear a lot of voices, all right?
Yes. What are you calling me about?
No. Not gonna do that, everybody. Mr. Smith, you dialed into the meeting, and it's a lot of us on the. Okay, Miss Renetta, can you hear me?
Yeah, I hear you, but I know what you're saying. Who's calling?
Okay, mute Mr. Smith, Kevin. I'm gonna mute me and mute Mr. Smith.
Okay.
I'm not muted yet.
Give me a second.
Kevin,
Yes.
when we vote, should we vote in the chat box?
No, we'll vote verbally. I'll call your name.
So you're going to unmute us and then
Yep.
let us vote and then mute us again.
Yeah. Yes, I'm probably only going to unmute or mute people when the presenters are on.
Okay.
Kevin.
Yes.
I don't know, but I can hardly hear you. My words are violating on my cell phone. Kevin, you got Jimmy on the phone?
Jimmy, can you hear me?
Yes, Jimmy, yes.
Yes, I see you. I think Renetta called you, didn't she?
It's a conference call with who?
It's with the whole board.
Yeah, this is Abdul Hawladar.
Hi, Mr. Hollader.
How are you?
Good. How are you? It's Kevin Hughes.
Good. Yeah, everybody's safe. Thanks God, everybody's safe.
That's good, Mr. Oliver. I'm happy about that.
You're calling for a conference? This is Jimmy. You're having a call with Jimmy Smith? Yeah, Jimmy, he just stay put. It's like a regular meeting with everybody over the phone.
Yeah, I do.
I'm holding on, Kevin. What you gonna call me about?
You're
Okay,
How you calling me? Straight answer, please.
No, I'm on the line now. I'm in the computer.
I love it.
Hi, it's Steve Kohanek.
Hi, Steve.
I couldn't get in. on the tablet. It didn't
Steve,
work.
this is Jimmy Smith.
Hi, Jimmy.
I'm
How
on the
are
line.
you?
Huh?
I am too.
Mr. Smith,
Who am I talking to?
This is going to be a great adventure.
No,
This is Hammond. I'm on too.
it's
Gonna be a magical mystery tour.
You there, Renetta?
yes, I'm here.
I've been in Connecticut all day getting my daughter stuff from college. I apologize for not calling sooner.
Trying to have
I tried.
who am I on a conference call with? This is Jimmy Smith. Who am I on the conference? Who's calling me?
You have Steve Kohanek.
Mr.
Steve,
Smith, it's Kevin Hughes.
Frank Taylor, I'm on the line.
which number is Mr. Smith, Kevin? Tell Mr. Smith to hang up. I'm gonna call him back. Mr. Smith,
Yes.
hang up.
Hang up.
Hang up.
Hang
Hello?
up.
I'll call you back. Hang up.
He did.
It's Joy.
Hi,
Hello.
Joy.
Yes, hi.
Hello?
Yes,
So,
hello.
Kevin,
This is
1 minute. We're gonna ask everyone to silence their phones.
Hi, Carolyn. I think so,
Too
but I
many-
guess my camera's not working. 'Cause
Hey,
I see
listen up.
top
Listen up.
end.
Too many people are talking at once.
Well, good luck. Wait. Can you hear me on that? Well, no, I don't know. Are you
I'm
able to-
on.
Hello? Can we all stop
Hello?
talking?
Kevin,
Yes.
this is Joyce Julian. It went through.
Yes. Hi, Joyce. How are you?
Hi. Okay.
Good to have you.
Yeah, I had a hard time.
computer, not an
Supposed to
iPad.
work on the tablet.
I understand that. I know what you said.
So what I have to do, Kevin?
Just listen.
There's a phone number to dial and dial the phone number.
I know, there always is.
There's so many people talking. I don't know.
Right. So you know what I'm gonna do, everyone? I'm
Yeah,
gonna
work on that.
start muting some lines. Okay.
We need to work on this. Put some buttons.
Hi, everyone. I just muted everybody so that I could say something real quick. If I could just have everyone's attention. I'm gonna mute the lines while people are checking in so that it's not so loud. A lot of people are coming in. If you need me for any reason, shoot me a text on the chat bubble all the way to the right, okay? If you need, if you're a caller, you know what? Let me bring in Renetta. Hold on. Renetta, Giovanna, there's really no way for the people that are calling in for them to communicate with me that they need to say something.
So what we're going to do when it's time for questions, we'll say, we'll call for like 3 questions, and the first 3 people, when you see the bubble pop up, you'll hopefully, I don't know how we'll identify them. That's the hard.
Right.
Well, I'd like to welcome everyone to our March meeting. I'm so happy that everyone dialed in. As you know, we're in a state of emergency, and we wanted to make sure Queens Community Board number 3 met for our March meeting. I'm happy that it was able and it was doable. So I'd like to thank all of you. I'd like to thank Ms. Reed. I'd like to thank the staff at the office to making sure that we could meet today. Today will be my last day in the office because I will be home. I'm working from home right now, and we will have committee meetings at home. So I want everyone, Kevin is going to open up the lines. But as you know, there's about how many people on the line here right now?
30.
30 of us. So please wait for Kevin to call your name, and then we'll do roll call. Followed by roll call, our meeting will begin promptly at 7:30. We'll say a few words and we'll wait for this. We'll give the presenter to the folks at Elmhurst Hospital that's supposed to start. They're our first presenter. Followed by Israel Rocha from Health and Hospitals, the director of the hospital. Followed by him around 8 o'clock. AC should be dialing into our call. We'll give her a presenter, right? Any questions? Rocha, please type it in the chat box, and we'll see how it will work with the folks that are on the phone, because it'll be very difficult. So board members, please look at that little bubble. That's the chat bubble, and Kevin will be monitoring it. So Kevin, are you ready to do roll call? Please just wait for your name. Do not all scream out at the same time, okay? All
Yeah,
right,
I'm ready. So I'm going to unmute everybody, okay? So no one, don't all talk at the same time, all right? Okay, now I've unmuted everybody unless you have muted your line on your end. So if you are muted on your end, you need to unmute. Okay, I'm gonna do roll call, all right?
Any background noise, please turn it off in your home.
Okay. Ann Brown.
Here.
Elba Buendia.
Somebody
Right. Mr. Chowdhury.
Yes.
Heiko. Heiko Corneliuson. Shiv Das. Tony Davis Roberts. Vivian Dock.
Here.
Margaret Dossier.
Here.
Renetta English is here. Mr. Gandhi.
Hello?
Mr. Gandhi? Mr. Gideon. Ulrich Gideon. Mr. Gideon, you got to unmute your phone.
That's okay.
Okay. Pastor Peter Haran.
Here.
Okay. Lorinda Hooks. Mr. Hollader.
Yes, sir.
All right, I am here. Kevin Hughes Novoa. Joyce Julian.
I'm here.
Nabaraj KC. Edward Kiernan.
Richard here. Here.
Stephen Kohenek.
Here.
Marta Leberton.
Here.
Carlos Andre Lopez. Bill Meehan. He was here. Lisa Masulam.
Yes, you hear me?
Yep, I can hear you.
Sorry.
Please don't talk if I'm not calling your name, okay? Thank you. Richard Mink. Ralph Moreno. Richard Mullings. Richard Mullings? Thought I just heard him. Laverne Nimmons.
Present.
Veronica Ing.
Veronica's here.
Nuala O'Doherty. Nuala? Philip Pappas,
Here.
Esteban Peralta,
Here.
Nadisla Perez, Dorothy Phelan,
Here.
Megan Rockwell,
Here.
Costa Rodriguez,
I am here.
Ira Rodriguez,
You're back.
Nancy Romero,
Okay.
Present.
Tammy Rose.
Hey guys, number
Here.
Oh, I see you. Okay. Edmund Rosenbaum, David Rosero, Sung Salaka, Smith. I know you're here. Jimmy, are you there?
Yeah, I'm here.
Okay, great. Marlene Tapper. Taylor. Arthur Tyler.
Yeah.
Arthur? Okay. Chanel Thomas Henry.
I'm here.
Pat Thorpe. Hamlet Wallace.
Yeah.
Was that Hamlet?
My
Yes.
email? Okay.
Yeah, that's Hamlet. Okay, great. And Toy Washington Simon. Edwin Wesley.
Here in my second.
Edwin, are you there? Oh, there I see.
I am.
Oh, great.
Hello.
All right.
Yeah.
Kevin,
Alba.
can you hear me?
Yeah, Alba.
Yeah. Who's
There-
this?
Kevin?
Is there any? Yes.
Okay, I just went from my phone to the computer. So do you see me and hear me?
I can't see you, but I can hear you.
Okay.
Giovanna. Buenos días. Hola.
Okay, I'm gonna go back through some of the people that didn't answer when I called their name, just to see if they're in. Okay, I'll do that in about 7 minutes. All right.
7 for my name. Giovanna, do you hear me? Can you hear me?
Yes, David.
Kevin, can you see me now?
I can see you now.
Hola. Hola.
See you
David, you have the phone.
Hola. Hola.
number
I do it on a 8-year-old computer that doesn't work.
No, Mike.
Hello, number
I do it on a tablet.
Oh, the mute doesn't work.
Hola.
Can't do that.
So this is the avocado. Oh.
Please pull it out.
Right, I'm gonna put everybody on mute. Okay.
Can you just review
Okay,
the rules, how we're gonna do everything, please, Kev?
Yep. Okay. So for those of you who just joined us, those of you that are on a computer, tablet, or smartphone, there is a chat option where you can send me or the entire group a private message or a message to everyone regarding a technical issue that you may be having, or perhaps you want to ask a question or something. So please use the chat bubble. The callers, unfortunately, are at a bit of a disadvantage because they do not have a chat option because they're calling in. So we will be opening the floor for questions from the callers at certain points, so that if you have any issues, you can raise them at that point.
I guess everybody's muted, so they can't respond.
Yes,
Right.
I muted everyone.
All right, so you can email it to you to tell her exactly at 7:30 if they can log in now, so that we can share the screen with them, so they can start, at least at 7:30, we can say, okay, here goes doctor.
Oh, yeah, okay. Well, actually, it should be the CEO.
Yeah, the CEO, Dr. Israel.
Right.
Dr. Rocha, yeah, Israel Rocha. All right, so everyone should have had accessibility to the reports that will, and all the different committee chairs that will be presenting today. But we'll open up the presentation by Elmhurst Hospital, followed by our Congresswoman should be coming in, and then we'll have our presentation on the virus, followed by our 2 public hearings, and our chairs are both here. Edmund is here physically, and virtually we see Ed Kiernan, so they'll be doing their hearings. We'll open up the session. Where's our flag?
Oh, yeah.
I'll get it.
Okay.
Okay, so we open up our meetings by doing the Pledge of Allegiance, followed by adopting the agenda, motions by committee, chairperson, district manager's report. All of these reports are in that Google Drive link I sent to you. We'll adopt the February 2020 minutes. Some of you may need to rotate the minutes, because I think it's in, not rotated all the way. Committee referrals, I do not know if any of our representatives will be joining the call today. Because as you know, normally towards the end of our meeting,
We'll do his introduction.
our legislators give a few words. So I don't know if any of them are joining us tonight,
And then we'll go into Dr.
except
the
the Congresswoman.
coronavirus thing.
Then we'll follow old business, new business.
All right, so whenever you're ready at 7:30, get ready to
But they can,
have the CEO.
all right, so Kevin, I'm going to make
Okay.
the Elmhurst
All right,
Hospital the
thank you.
presenter. Or do you want to do it? Let me see. You can click on the chat, on the people, you can see the additional members that joined. Kevin, you see that?
Mm-hmm.
So you can just
Yes.
take it from there.
Yeah, I'm gonna actually call just a few names that weren't in the original roll call, that didn't call out in the original roll call. Okay.
And just unmute them, that particular person.
Say that again.
Just unmute that particular person so they can do their verbal here. Or you want,
Right. I'm gonna have to unmute everybody because some of them I think are.
okay.
Okay. All right. So I'm just gonna, in about 1 minute, I'm gonna wait until we hit 7:30 on the dot, and then I'm gonna do the final attendance. Okay.
All right, and what I'm gonna do exactly at 7:30, that's when I'll make Elmhurst, after you do your last couple of people, then I'll make Elmhurst Hospital the CEO, the presenter, excuse me, Mr. Rocha.
Terrific.
Is that how you pronounce his last name?
Rocha, yeah.
Rocha.
Is Vivian,
Vivian's here.
Oh, okay.
Okay, do you want to just start doing that now, just before, to just
Yep.
call the?
I will do it now. Okay. All right. Is Heiko with us? Oh, wait, let me unmute everybody first. All right, please don't all talk at the same time because I'm going to unmute everybody. It'll get real loud. Okay. All right. Is Heiko with us? Heiko? Shiv Das? Davis Roberts? Mr. Gandhi? Lorinda Hooks? Nabaraj KC?
Yes, I'm here.
Great.
No.
Carlos Andre Lopez?
Here, they have.
Oh, you have to.
Richard Mink? Ralph Moreno? Richard Mullings? Jairo Rodriguez? Jairo? David Rosero?
I'm here.
Okay, got David. Frank Taylor?
I'm here.
Frank, you're here. Great.
Yes, I'm here.
Pat's here?
Hello?
Pat Thorpe?
Hello?
Oh, no.
Yeah.
Oh, she's there?
Pat?
Yeah. Oh, wonderful.
Okay.
Yeah.
Toy Washington Simon?
Huh?
Is Toy with us?
Or what?
Right.
I got a bad connection.
It's just there's a lot of people on, so I'm gonna mute some people here, just so that I.
Hello?
I'm gonna make some presenter.
Hello?
All right, I had to mute everybody.
Tell her to put her computer screen on to see if I can see her computer screen. Can you put your computer screen on? Okay. And you can take you have to take the, you have to take Elmhurst, okay. Take Elmhurst Hospital off, Kev.
Okay, give me 1 sec. Hold on.
Did you call all the members you needed to call?
Yeah, it was, hopefully I got everybody.
This is Ladisla Perez. I'm here. I didn't hear my name.
I did, I got you, Ladisla.
All right, thank you.
Anybody else?
Thank you.
Call one more time.
You did get me?
Who's here?
You did get me?
Who's that?
Did you get me? Did you get me? Did you get me?
Yes.
What's your name, sir? You have to say your
Did you get
name.
me?
Mr. Gideon.
Say your name, sir.
This is Gideon.
Mr. Gideon?
This is Gideon. Did you get
Yes.
me?
I got you, Mr. Gideon.
Gideon.
Yes, I got you.
Yes. Okay, thank you.
Okay, does everyone see the presentation?
Yes.
Okay, very
Yes.
good. What we're gonna do is, as Kevin explained, I welcome everyone that's on the line, board members and members of the East Elmhurst, Jackson Heights, North Corona, and wherever else you're dialing. Welcome to the first Community Board 3 monthly virtual meeting. Yes, it is recording. Okay. We will begin our presentation by the CEO of Elmhurst Hospital, Mr. Israel Rocha. Are you here, Mr. Rocha? We see his presentation, but we do not see him. Can we put him? Do you see him there, Kevin?
I'm looking.
No,
Yeah, I
we don't
see him.
see you though.
I see him though. I see him.
Okay, because I guess I can't see. Let me do here. How can I see?
You have to scroll through the photos, the cameras.
Oh, I see. This is our first time, sir, doing it, so.
Mine too.
Well, thank you. Whenever you're ready, the best community board in Queens. City of New York. Sorry. Go ahead.
So one, I want to start by welcoming everyone and then thanking you for giving us the opportunity to share and be with you today. I'm very happy to be joined by Dr. Joseph Massey, the chairman of Global Health here at Elmhurst Hospital. A few years ago, Dr. Massey had a great vision of creating a global health department, recognizing that some of the concerns healthcare in the future are not bound by border, but are actually a global condition. And so we wanted to make sure that we were keeping our eye on the ball and being able to be prepared for a situation, unfortunately, that we find ourselves in today, where pathogens and disease and illness can transcend the entire globe, and how we can work together as community, partners, and how we can be able to work together.
Go ahead, sir. Sorry.
So I wanted to make sure that we created a center that would be able to track illness and pathogens across the globe. And so Dr. Massey is our head of epidemiology. He's also the head of global health. He is an infectious disease specialist who is consulted to the United Nations, the CDC, the World Health Organization, and around the country as a foremost expert in pathology and infectious disease. And we're very honored to have him here on our staff. Now, what I would like to do is share, welcome him to our conversation and to be able to discuss the issues, but also I would have this opportunity before he presents to answer any questions that the board may have. Elmhurst Hospital is here. We're ready to serve. We're using and working with our staff to be here at this time of importance for our whole community. And we're making sure that we have all the resources available to treat and serve the greater Queens community. So we are available and we're here to be able to help, but we're also here to start with helpful information so that we can answer the questions that are on everyone's minds and hearts. And so if you would like, we can answer questions or we can proceed to the presentation by Dr. Massey, whatever works best for the board.
Hello, can you hear me? This is Renetta English. How are you? Well, we're going to have the presentation followed by the presentation, then there'll be questions, okay?
Okay.
And,
wonderful. Then I'm going to go ahead and turn it over now to the Congresswoman.
Okay. And I just want to let you know we may have a break in the presentation because we are having our Congresswoman come on like around 8 o'clock, but please continue with the presentation, all right?
Wonderful. Then I'll go ahead and turn it over to Dr. Massey and I'll let him start with the presentation. Then we can answer the questions together. Will that work?
That's perfect. Thank you so much.
Give us
and
one.
I think the presentation needs to be put in presentation mode because right now the slides.
The presentation mode. So let me try that real quickly. And we'll try if something happens. We'll come back in a few seconds, but let me try real quickly.
Okay.
The borough president is going to somehow come in at some point.
And everyone, our borough president will be joining the line also.
Got it. Can you still hear us and you see the presentation?
Yes, we can. Thank you.
Wonderful. Then I'm going to go ahead and turn it over to Dr. Massey. Give us 1 second.
I don't know if you take pictures of this. It's already on TV.
Hello, everyone. Can you hear me?
Oh, they turned it on. Oh, that's right.
Can you hear me?
Yes, we can.
Great. Okay.
Yes.
So it's I'm Dr. Joseph Massey. I'm the chairman of Global Health here at Elmhurst. And I wanted to go over some aspects of COVID-19. Now, this is changing very fast every day, as we know. And some of the statistics I'll show you are from this morning, and they've actually changed somewhat during the day. But let me get started. Let's start with what is a coronavirus. Coronaviruses are a large group of viruses which infect mammals and birds. They cause a lot of different syndromes. They're basically fairly innocent viruses, though. They're primarily respiratory pathogens. They typically cause mild disease like the common cold. They can mutate frequently. There are a lot of subspecies of these viruses. And in general, they're spread by human-to-human transmission once they get into us. Now, I say that because there are many other animal hosts in the environment that can carry these viruses, and the ultimate definitive host is the bat. So, oddly, there have been 3 outbreaks of very different coronaviruses in the last 16 years. This was not expected, and it's not really fully understood why this happened. These innocent cold viruses have caused outbreaks such as SARS, the severe acute respiratory syndrome, in 2003, 2004, MERS, the Middle Eastern respiratory syndrome, which began in 2012 and is still continuing, and of course, COVID-19 this year. So how did this start? Well, we all know it seems to have started in China. Exactly when it started is not clear, though. Although the Chinese government has said it began at the end of December, there is evidence to suggest in the epidemiologic curves that it probably began a month or 2 before that. There's several theories as to how it began. We all know about the market in Wuhan, China, where it seemed to have been an epicenter for this. In that market, they sold live animals, they slaughtered animals for sale. But exactly which animal it is that caused transmission to humans is not known. Because the Chinese authorities cleaned out the market before the source could be identified and the investigation could be completed. The latest reported figures on this as of this morning are truly alarming. 230,000 confirmed cases around the world with over 9,000 deaths. 86,261, that number is the number of patients who are fully recovered. And you see in black 2 countries that had a surge in cases in December and into January, and so far have seemed to have brought this outbreak under control. Although that may be changing again, we don't know. The countries in yellow are the countries where it's currently exploding. Italy has had a very, very dramatic problem with this, and since this morning, the number of deaths in Italy actually exceed the number of deaths in China. Iran has also had a very, very peculiar pattern with this, with a very high mortality rate and over 18,000 cases. Germany and France, the countries of Western Europe, are now becoming increasingly involved each day. These are countries where the numbers are rising every day. And of course, the United States, so far, as of this morning, we had 10,816 cases. Now it's well over 11,000 with 161 deaths. That's gone up as well. And we had 1,557 cases in the 24 hours before these figures were compiled. This is the map of the world where the virus is, and what's so remarkable about this is how quickly this really went all the way around the world. There is no continent except Antarctica that has not had cases yet. The cases that you see, the red circles, are where the concentrations have been so far, but we see cases in South America now, in Africa, Australia, etc. So this is really a global outbreak, and it was declared a pandemic last week. Each day in the United States, this is data through earlier this week, the number of cases goes up. This is an epidemic curve that we've seen all over the world. But countries have had various patterns with this. As I mentioned, mainland China and South Korea seem to have seen the end of their outbreak. Now, I'm being careful about that because we don't know what's coming next in those countries. Mainland China put a lot of the population under restrictions. They had over 700 million people under some kind of restriction for about a month, particularly in the area right around Wuhan. And they brought their outbreak, at least in reported cases, under dramatic control by the beginning of March. South Korea had a peak later. It was largely attributed to a religious cult there. They too have had reduction in cases that have been dramatic. You see the epidemic curve there. Iran and Italy have had a different pattern, of course. They have not yet reached their peak, and Italy, and both of these countries, but Italy in particular, is on a very, very tragic course right now. And there you see the United States, and I have Spain there as an example of a Western European country that's now becoming involved by this. In New York State, as of this morning, there were 4,152 cases, 21 deaths. There were almost 2,500 cases in New York City and 11 deaths so far. And I just point out to everybody, I'm sure most of you remember this, 2 weeks ago there were no cases in New York City. In fact, there were only 15 cases in the United States. This is a very, very rapidly moving epidemic. So what are the clinical features of this infection? Now, based on 181 cases that were analyzed in China, the latency period is 3 to 7 days with a maximum of 14 days. What a latency period means is the time in between where exposure to the virus seems to have occurred and the onset of symptoms. That latency period is very unfortunate for COVID-19 because it indicates a period during which an individual may not have symptoms at all. And we know now that during the latency period, the infection can be transmitted. Of these 181 symptomatic cases, half of them developed symptoms within the first 5 days. Nearly all had symptoms by day 12, and they were contagious during the latency period. The symptoms are really quite common. They're familiar to all of us, I think. They are flu-like symptoms of fever, sore throat, dry cough, chills, etc. Shortness of breath is a particularly ominous sign with this, and when it has occurred, it typically has occurred before day 8. And there's been a characteristic pattern with this disease, which is also difficult for us to identify, and that is after that latency period and the onset of non-specific cold-like symptoms comes a onset of lower respiratory symptoms, and then in some cases, a very dramatic decompensation. with the development of the acute respiratory distress syndrome, septic shock, and et cetera. And that accounts for the fatal cases. The signs as opposed to the symptoms. The signs, shortness of breath, moist rales in the lungs, weakened breath sounds, dullness to percussion, this is over the chest, and increased or decreased tactile speech tremor. Chest x-ray findings, there's been some emphasis on this. The x-rays are fairly non-specific. When they show anything that's somewhat identifiable, there are these peripheral, I'll show you a picture in a second, these peripheral dense consolidations. We don't know exactly how often an identifiable x-ray pattern is present. It would be very, very helpful if it was, but even the radiologists don't believe that this is a reliable enough finding, but it is quite dramatic on the x-ray in some patients. And you see a picture of that here. It's from a case in Korea. On the left, you see a plain x-ray, and you see the peripheral infiltrates. The middle and right-sided cuts are CAT scans showing the peripheral infiltrates. And I'm emphasizing that because when there is something characteristic about it, it's that the infiltrates are peripheral. They're up against the chest wall, and that's unusual. Most pneumonias, the infiltrates, the densities in the lung, are near where the airways enter the lung. They're near the heart. They're not near the chest wall like this. So there may be something characteristic enough in some of these cases to identify a case quickly with a chest x-ray, or CAT scan, but unfortunately it's not clear that it's common enough to do that. So what is the differential diagnosis of all of this? Well, of course, during flu season, which is finally coming to an end now, influenza was the commonest differential diagnosis. But you see here many, many other respiratory organisms that can mimic many of these findings. Now, most of these infections, with the exception of influenza and the exception of bacterial pneumonia on the right-hand side, are self-limited infections that are fairly manageable and not very symptomatic, really. Influenza, we know, is a big killer. There have been nearly 20,000 deaths this year from influenza, and this outbreak may quickly overcome influenza statistics. We don't know yet, but the other organisms on this page are relatively innocuous. So what have been the international strategies for containment? These have varied a lot from country to country. We're trying to learn some lessons from countries where it's been successfully contained. In China, after January 23rd, about a month after the outbreak was recognized, travel into and out of Wuhan was stopped. By January 30th, adjacent cities were locked down, and a total of 50 million, really closer to 60 million people were completely locked down. Eventually, there were 760 million people covered by some type of lockdown. Armies of enforcers went door to door. They checked temperatures, and patients with fevers in Wuhan were removed from their homes and placed in quarantine centers. In Singapore, which is a considerably less militant environment, but a lot more controlled and organized than ours is, early cases, and really almost all the cases in Singapore, were traceable to China. There was very little community transmission in Singapore. So they had a very recognizable entry point of their cases. They did very meticulous contact tracing. They had very early availability of rapid testing for this, and they quarantined people on site within hours of identifying them. And Singapore has had a very successful approach to their outbreak, and it is nearly under control. And again, with China, with Singapore, with South Korea, let's keep in mind that the outbreak can resurge again. Right now, it seems to be under control. South Korea, that was the River of Grace Church, where 60% of the cases were directly or indirectly connected to that church. 87% of the cases were concentrated around where that church is in Daegu, in the southeast and adjacent North Gyeongsang province. This week, though, cases in Seoul for the first time exceeded the cases in those regions, and that is an ominous sign. Although the overall outbreak has been brought under control in South Korea, the cases in Seoul are now beginning to spike a little bit, and we may see a resurgence in South Korea. So what I've described to you is 3 different strategies for containing this infection in 3 different countries and really 3 different societies. So Italy, why has it been hit so hard? Italy, unfortunately, mirrors some of the problems that we have here. There was initially very limited access to testing. Those of you who've been following this may remember it was initially thought to be confined to the northeastern areas in Italy, but it was soon recognized that it was all over the country. And when I say soon, I mean as soon as testing was accelerated. Italy has had a high death rate, and some of that may be due to the fact that it has a relatively old population. In Italy, they have the second oldest population in the world after Japan. South Korea, for example, has a much younger average age. Also, smoking is very common among men and women in Italy. In South Korea, very few women smoke, and smoking-related disease may be connected to bad outcomes with this. I show you some information about Africa. Africa is now beginning to emerge as another hotspot for this, as is India, I should say. So far in Africa, as of yesterday morning, there were 350 people diagnosed and 7 had died. Most cases were seen in people who were arriving from Europe or North America, but 27 countries, as of yesterday, had cases. South Africa has been the hardest hit so far, and they've closed many of their land crossings and 2 of their seaports. Foreign nationals, including from our country, have now been banned from South Africa, and all schools have been closed. So what are we doing in our country? Well, what we're doing reflects a couple of what we believe are facts about this infection. First of all, how contagious is the coronavirus? What you see toward the bottom of this screen in dark brown and red is this coronavirus. It is more contagious than Ebola, which was not very contagious. It's about as contagious as influenza, but it is far less contagious than measles. So it is reasonably contagious. The chart on the right, this is a chart you see in epidemiology courses a lot. This is a illustration of the number of cases that would arise after exposure to a single patient with this. Once again, you see measles in the lower right, 17 or 18 cases after a single exposure. This is back around where SARS is. You see it right before SARS, right after influenza, with 2.5 to 3 cases after an exposure. So what are we trying to do in this country? The infection is here. The more testing that's done, the more cases are identified. And what we should be trying to do and are now trying to do is this. This is a common illustration of the way in which an epidemic can be ameliorated. On the left, you see a high spiking curve. That's the curve of an uncontrolled pattern of transmission. If nothing was done, that would be the curve we would see here. It's a little reminiscent of what they saw in China, but it would be much bigger here because it's popping up in many parts of our country. By instituting proactive measures, allowing people to isolate at home, avoid social contact, etc., the types of things we've been hearing about and talking about. And in our country, probably very importantly, closing off stadiums, ending baseball season, basketball, hockey seasons, canceling concerts, etc., removing these opportunities where people congregate together has been a very good strategy in our country, and hopefully it will pay off. And what we're doing in hospitals, of course, is improving capacity to identify patients and to hospitalize those who are sick. And what we're hoping is the curve on the right will be what we see in our country. The dotted line represents the capacity of the US hospital system. It could be rapidly exceeded or it could be only slightly exceeded, depending on how successful these mitigation efforts are. Testing for COVID-19 has been a problem. There was a very long delay in getting adequate and sufficient testing. Currently, the City Health Department strongly recommends against testing people who have no symptoms or only mild symptoms, unless somehow knowing the diagnosis may impact on our management. And I'll come to how that might be in a little while. Home isolation should be considered for people who are thought to have this infection, even if it isn't proven. And that will minimize the exposure of healthcare workers. We really have to be cognizant of that. We don't want to keep repeatedly exposing healthcare workers by having people who are minimally symptomatic come to the hospital for treatment. Also, we want to reduce the community demand for personal protective equipment. It's really needed by the healthcare workers. Complicating this a little bit more, there are false negative tests. Retesting should be considered if it is being conducted at all. If a patient has a suggestive clinical syndrome and their initial test is negative. Just like that initial few days allows for a patient to transmit this without knowing they're infected, unfortunately, during those initial few days, the diagnostic test may also be negative. So who should we test? We want to focus the testing on people who are actually short of breath. That's the symptom that is a key, that there is respiratory progression. If a person is only mildly ill or not ill at all, these are guidelines that were published yesterday by Tom Frieden, the former city health commissioner and former director of the CDC. We can use up tests that might be needed by others. People can spread the infection while they're going somewhere to be tested or waiting to be tested on a long line. They could get exposed if they're not already infected by gathering like that. The result may very well not change what a person does or what sort of clinical management they get. And as I just said, a negative test does not mean that you don't have this infection now and that you can't get it. And a positive test usually doesn't change anything. And I would point out one really important thing that it's easy for all of us to somehow lose track of, and that is, because you don't have this infection today, it does not mean that you can't get it next week or the week after. So we have to be careful that we don't do endless testing of people where it doesn't really mean anything. We have no test to demonstrate immunity to this infection. We may have that one day, but we don't right now. Laboratory diagnosis, I'm not going to belabor this. So far, it has been a somewhat onerous process. The laboratory facilities from CDC, you probably know about the problems that there were when the CDC tried to distribute their kits that had to be called back because they were faulty. Private laboratories have taken over. There are many private laboratories that are currently involved in this, and we're hoping soon that we will be able to do our testing right here in the hospital for this. Positive tests are reported to the state and city, rather the state health department and the CDC. How do we protect the staff and our other patients while this is happening? There are general infection control measures. Washing your hands with soap and water, it's better than any Purell you can find. Stay home if you're sick. If you can possibly stay home, you should. Cover your cough and sneeze with a tissue. Throw the tissue in the trash and wash your hands. The CDC does not recommend that people who are well walk around wearing a face mask, but in the hospital, increasingly, we are doing that in order to protect vulnerable people from us in case we have early signs of the infection. But we have to be careful that we don't use up all the surgical masks by people using them in the community who don't really need them. If you've returned recently, within 14 days, from a country where there is a lot of this infection, particularly now Italy, Western Europe, Iran, etc., you can return to work, but you have to check your temperature twice a day and monitor yourself carefully for respiratory symptoms. I was just giving advice before I came here to a person who has a relative who just got back from Japan, and that's the type of advice that they need, just to cover their cough and remain as far away from people as they can over the next 14 days. In the hospital, every patient who's under investigation, that means a patient who on initial assessment is thought to possibly have this, is given a surgical mask to wear. The patient is placed as far away from others as possible in a well-ventilated space. They're placed in a negative pressure room if one is available, and if they are in the negative pressure room, they can take their mask off. The providers are required to place themselves in personal protective equipment. The current standard is a surgical mask or an N95 mask. They're thought to be equally protective of providers. One pair of gloves, eye protection, which consists of a face shield or goggles, and an isolation gown. PAPRs or CAPRs, these motorized devices, are in short supply, and they may be a solution for some healthcare workers under some circumstances. These are the masks I'm talking about. On the left, you see a surgical mask. The way to tell a surgical mask from other types of masks, it has the loops that go only around your ears. Anybody can wear this. You have to keep it over your nose and mouth to have it be effective at all. And this is primarily to protect other people from you. On the right, you see the N95 respirator. N95 means it filters out 95% of particles above a certain size. These have to be fit tested. And we do this as an exercise every year for all the healthcare workers who take care of patients in our hospital. The mask fits tightly, and it is to protect the wearer from infection. The loops on the side go around the back of the head, and this is a very different undertaking than placing a surgical mask on. If you don't know how to wear an N95 respirator, if you've never been trained to do it and fit tested, it may not be any more protective than wearing a surgical mask. For hospitalized patients, common things are done for these patients. We treat their water and electrolyte imbalances. We monitor certain markers in their blood. C-reactive protein and procalcitonin are particularly effective. Interestingly, the liver function tests were abnormal in virtually all the cases that were seen in Washington State last week, so we certainly look carefully at those. But respiratory support is the key maneuver that we're using. This is divided into 3 categories in terms of respiratory support. People with mild to moderate symptoms just require supportive care. These are the patients who can be sent home. For severe respiratory symptoms, where there is an opportunity to give them supplemental oxygen by an inhalation mask, etc., that can be tried. We are quick, though, to place our patients on ventilators because of that danger that they may rapidly deteriorate. Mechanical ventilation after endotracheal intubation is required in those patients. They can be repositioned for better ventilation. We have a number of patients in our hospital today who are on ventilators, and we are hoping that they will fully recover. So what are the major challenges that we face? Access to testing continues to be a problem, although we expect that to be sorted out within the next week or two. The strategy for testing versus quarantine has now been better elucidated by the City Health Department. We are not testing large numbers of the community. We are sending people home with precautions, with guidance. The supply of masks right now in the city hospital system, both types of masks are in jeopardy. We have more of the surgical masks, the masks that are given to the patient, than we have of the N95 masks. But the city health system is, the HHC is looking really carefully at maximizing our supply of those. Flu season, of course, as I said, is coming to an end. The difficult thing is the last one, projecting how bad this is going to get. It's quite possible, it's very likely, first of all, that we will see a massive surge in the number of cases over the next month. It's predicted that we will hit our peak in the first couple of weeks of May. And by that time, we may find that many of our acute care hospitals, like Elmhurst, are almost completely converted into intensive care units to manage these patients. We need the equipment and the supplies to manage patients in those circumstances. And H&H is fighting hard. They're very good at this, at getting the equipment and supplies that we need. But we are trying by every measure we know how to institute to bring our curve down and not have it hit catastrophic levels, as I showed you on that chart. So what does the future hold? Antiviral treatment and vaccines have received a lot of attention. There are several different antiviral drugs that have some potential role in this. Hydroxychloroquine is a drug that we're using. It's FDA approved for malaria, and it's being given to about 45 patients at Elmhurst right now in an uncontrolled fashion, but a standardized dosing, and we're following those patients carefully. And then a number of other drugs you see listed here. Remdesivir, the 4th drug down, has received a lot of attention, and this is a drug that we may be utilizing soon as an investigational agent on an expanded access approach. And then you see some of the other drugs that have been considered for treatment of this. I think one thing that we may have as an advantage in our country is we can look at the experience in China, where they did have a lot of treatment experience with hydroxychloroquine, and we can make a decision whether there is enough data there to strongly support using it. And I would also point out that using a drug like hydroxychloroquine, for which we do have a long experience, it's quite possible that we can successfully look at this for prevention. And that's a protocol that we're interested in introducing here soon. Experimental treatment, and we'll go over this over and over again. The problem with remdesivir, it looked very promising for Ebola, and it got a bad name because it didn't work for Ebola. It looked good in the test tube, and it's looked good for MERS and SARS. We just don't know whether it is going to be as effective as it looks in preclinical trials, but that doesn't mean that we won't try it. We've reached the point where we have nothing that we can offer except somewhat unproven treatments. These treatments I call unproven, but they are very likely to be at least somewhat effective. For one example, hydroxychloroquine, there have been several studies that show that the virus is actually cleared from respiratory secretions after about 6 days in patients receiving that. Vaccine development, there's a lot of politics around this. I can just summarize by saying there will not be an effective vaccine that's widely available for at least 1.5 years or 2 years. There are a variety of companies that are working on vaccines, but the way vaccines are marketed, they have to be proven to be effective. They have to be tested in small preclinical trials and then clinical trials and then comparative trials, and that takes a long time. And I would just remind everybody that when there is a vaccine for this and it's considered safe and effective, we should all take it. Unlike the flu vaccine, where every year it is a struggle to get everybody who should take it to take it. But vaccine development is a reasonably slow process. Maybe there will be a sudden breakthrough, but I don't think we should be anticipating it. So what will the future bring? It's almost certain that there will be many, many additional cases in the United States, and unfortunately, tragically, many additional deaths. How many cases and how many deaths over how short a period of time is what we don't know right now. Things will get worse before they get better. We have to be careful about confusing messages. I would encourage everybody here to look carefully at the websites that I'm going to show you in a minute for the WHO, the CDC, and webinars, which is tracking this epidemic, and not pay too much attention to other sites on the internet. We have to be careful. One thing that we have now that they didn't have during that SARS outbreak, they didn't have the internet. And now we do. And we all know the pitfalls of looking at the internet for opinions sometimes. Very likely, but not certain, further restrictions on travel into and outside of our country. These are coming out each day now. Hospital crowding could reach a point of being insurmountable for us. We hope not. Hospital supply issues we think will be manageable, but we're not sure. Vaccine I've talked about, and antiviral drugs probably sooner. There will be data on these. So this is the list of websites. For more information, the first one is the World Health Organization. That can give you information on the global pandemic. The CDC has a wealth of information on what's happening in our country, state by state, how people should protect themselves, what guidance is being given for treatment, hospitalization, etc. And that bottom side I find very useful. Worldometers, they update the global picture. It's very, very up to date several times during the day. And if anybody is just interested in seeing what the pattern of this is worldwide, including in the United States, I would strongly encourage you to try that one. So I'll stop there and thank you very much for your attention. And if we have any time for questions, I'd be happy to try and answer any.
All right, Dr. Massey, this is Renetta English, Chair of Queens Community Board number 3, and we thank you for a wonderful presentation. And I'm going to turn over, we have a number of questions that were posted in the chat area, and Kevin Hughes will conduct those questions. And what we're going to do is we're going to take you off of presenter mode. We're going to remove from your, do you think we should leave it up, Kevin? Maybe folks have questions on the
Yeah.
okay, so I'll just leave it out.
Yeah.
So Dr. Macy, folks may ask you to go back and forth in your presentation to highlight certain slides, okay?
Okay, so Nabaraj, you were the first one to ask a question, so I'm going to turn it over to you.
My question was about the coronavirus.
What is your question
Hello?
about coronavirus?
I can hear you.
A lot of people keep saying that it was made on the lab. Is it true?
I don't think it is. It's an interesting question, and I've gotten it a lot. I think, you know, every time there's an outbreak of anything new, there are early suspicions that somehow it's a biological weapon that got away from somebody. I don't think it is. First of all, the way it's widely transmissible. If you were going to create a biological weapon, you would not make it that would one like this that would target everybody, military, general population, everybody. But more down to earth, the way this virus has mutated, this is very similar to what was seen with SARS. It's a different type of mutation that was seen with coronavirus, and that was seen with MERS, and we've just become more familiar with the patterns in which this virus changes itself. I don't think that this is a bioterrorism event. I think this is a jump from animals into humans because of the live animal slaughtering that was occurring in that market in Wuhan and around there. That unfortunately is a pattern we've seen with some other pathogens, jumping from animals into humans. And I don't think there's any reason to think this is anything other than that.
Okay, thank you.
You're welcome.
Thank you, Nabaraj. Can you mute your line, please?
I will. Thank you.
And now, Renetta, you had some questions that you wanted to ask?
I guess one of my first questions, what is the rate of patients that you're seeing currently at Helmers Hospital and the age ranges?
Yeah, the number of patients we're seeing is going up very quickly. We've seen confirmed cases, I think about 130. If you'd asked me that question last week, it would have been just a handful. Currently in the hospital, because of the problem in getting test results, which is on the verge of being solved, but since it can take several days, we have both confirmed cases and people under investigation. The confirmed cases, we have about 25 or 30 in the hospital right now. Some of them are waiting in the emergency department for beds. We have a much larger number than that of these people under investigation. So that's the pattern we're seeing so far. Now, we do expect that will change quickly, and we'll continue to see an upward trend for at least another month.
I have a question. Can you hear me?
Yes.
Okay.
Just for everyone
Yes.
to know, Kevin will be calling out everyone's name. Let you ask your question, but Kevin will be calling out each person's name. That's on the list.
I'll call. Yes,
Okay.
thank you, Lisa. When I call your name, you can ask your question, okay? But we have to
Thank
go
you.
in order of people, okay? Thanks.
Thank you.
All right, thank you, Renetta. So now I'm gonna unmute Labsang. Labsang, are you with us? Do you have a question?
Yes.
And laptop, before you begin, everyone, if you want to see who's talking, on the top of your screen, you can select view who's talking to see that person. But go ahead.
My question is, it seems like fewer cases in Russia at this time. Why do you think like they have fewer cases in Russia? And is the Elmhurst Hospital kind of overwhelmed or is ready to kind of cope with the situation?
Well, the situation in Russia is always a little difficult to interpret since we know we had an AIDS project in Russia for 10 years, and they were very reluctant to report their AIDS statistics. So I'm in touch with Russian physicians in St. Petersburg. They are beginning to see an uptick in this there, and I think we have to wait and see whether Russia is going to be spared. I doubt that they will be spared. And what was your other question?
The other question was the Elmhurst Hospital.
Yeah, how are we doing? We're fine right now. We have very good equipment and supplies right now for these patients. We have a lot of experts caring for them here. When we get the rapid turnaround on testing, that'll make things much more simple for us. And as this outbreak converts into a very large-scale outbreak nationally, we will see much more attention over toward treatment of hospitalized patients, because there will be so many, and away from community testing, which has taken up a lot of our resources so far. So right now we're fine. Obviously, all of us in New York City have to be very, very cognizant of how this could get much worse.
Thank you.
Okay. Thank you, Labsang. All right, Giovanna, you had some questions that you'd like to ask?
Oh, okay, yes. It seems that the virus has been around for a while. Coronavirus is listed on the Lysol sanitizer.
Right.
Okay. So my second question is, if
Your glasses on the floor.
Sorry?
I'm sorry. Yeah, I would just say while you're asking your second question, coronaviruses have been around for a long time. We've known they've been around for a long time. And the reason that they're listed on those sanitizers is that they're common causes of the cold. It's these new aggressive dangerous coronaviruses that are novel and that are different subspecies.
Okay, my second question is, if an individual has contracted the virus and therefore have those signs of the virus, can that individual get reinfected?
Well, if they've actually been infected, we don't know the answer. If they are infected and recover and have a typical antibody response, it may be that they're immune. But if you're asking the question, can we be repeatedly exposed even after we've been exposed? Of course we can. And I think right now in New York, one thing we have to keep in mind is the outbreak is growing. There are lots of people in New York undoubtedly right now who have it, who don't have any symptoms. And if we encounter one of those people and are in too close proximity, we can catch this. And we can catch it even though we were tested the day before. But to answer your first question, if you have been infected with this and you have an adequate host response, we are hoping very hard and assuming that you will have immunity to further infection once you have been infected. And that may be what happened in China. That may be why the outbreak there seemed to come down so quickly.
Thank you.
Okay, now I'm going to hand this over to Megan Rockwell. Megan, are you with us? Megan? Megan, if you're there, you need to. There you
Yeah,
go.
actually, Megan had to step away for a second. This is her husband. Do you guys okay if I ask the questions?
Sure.
Sure.
Okay, so for first part of the two-part question, first is what do you make of the recent study that children are now having bad outcomes? And two, what are your suggested best practices for going to the drugstore or the supermarket or deli? And three, do we need to wipe down if we get deliveries like box deliveries, food deliveries? What do we need to wipe down and sanitize?
I would be very, very cautious about anything that's delivered. And if you can wipe it down, it doesn't have to be with Purell. It can be with soap and water. I would do that. We certainly do that at my house. We don't have a lot of deliveries. I would be really careful about getting food brought in, anything like that. Your question about children, the data from China seem to suggest that children were relatively spared from this. But what we've seen since then, both in Italy and in our country, is there has been a really significant on children. Now, the younger the child, the more resistant to this they seem to be. So very, very young children and infants seem to not get as serious an infection as older children and adults. But the idea that children can't get this, unfortunately, is not turning out to be true. And I've forgotten the first part of your question.
And just what are your suggested best practices for going to the drugstore or the supermarket or or any to get to go outside to stores if needed?
Yeah, I think the best advice that I have heard on this is to pretend that you have the infection, and that will remind you to stay away from other people, to not be within 3 feet at all, certainly, and best not be within 6 feet. If you have to go to the drugstore, obviously that's something that sometimes can't be avoided, and you have to go to the food store, just try your best to maintain those distances. That's really what you can do right now. And I think, if you do that sort of thing, if you cover your cough, cover your sneeze, if you wash your hands faithfully several times each day, maybe many times each day, just be really cognizant, as often we're not, of all the different things you touch during the day. Soap and water, if you have access to a sink and soap, that's the best way to wash. If you don't, then these alcohol-based hand rubs, if they have more than 70% alcohol, like Purell, seem to be effective. But these are simple pieces of advice that we would give in any spreading infection, really. And we probably all told our children this sort of thing about washing their hands. Now we have to really, really do it. And I think that's an important part of lowering our curve in this country. And that's about all you can do as an individual, but please do it.
Dr. Massey, we're just going to break for a quick second because we're going to have our congressman say a few words. Congresswoman say a few words. Do you mind?
Not at all.
So I'm just going to take you off presentation mode. There you go. Go ahead.
All right, hello everyone. Is everyone there?
Yes, we're here.
Hi everyone. I'm sorry. I know there's a lot. You all have a lot more healthcare and kind of the medical and science related questions. So I just want to pop in and let you all know, just give you a quick update. We've been in constant communication with the heads of every hospital in our congressional district. That means East Elmhurst, New York Presbyterian. We also have been in touch with, on the Bronx side, Montefiore, Jacobi Medical Center, and more. And really what we're starting to see a little bit is that on the Bronx half of the district, we are seeing some rising cases, but really we're starting to see that surge a little bit more in Queens. And so we are all trying to mobilize in making sure that every hospital is trying to coordinate and support each other as much as possible. For those of you who may not have seen or heard yet, Governor Cuomo, and we've been working with Governor Cuomo to make sure that we roll out a moratorium on all mortgage payments for the next 90 days. So if you have been impacted by the virus and financially and are not able to make your mortgage payment in the next 90 days, there is an exemption and there is a suspension and moratorium for your mortgage payment made for you. Now, the next step that I'm really starting to fight for is to make sure that that also applies to renters as well. As most of us know, about 2/3 of the city also constitutes renters. I think that if we're going to give folks with mortgages a break, we need to make sure that we're giving folks with rent that are renters, including myself. I don't need it, but of course, you know, I am a renter. And so I think it's really important that we get everyone the help that they need, that no one gets displaced by this crisis. On the federal level, there was limited paid leave that was put. We need to now push so that it's universal paid leave. And, you know, from our district and our community, I'm keeping an extra eye out and really making sure that we're pushing policies for hourly workers, gig workers, contract workers, and freelancers, because those are the folks that tend to get left out sometimes, or the policy isn't written in the best way to include their needs as well. So right now, our focus is on making sure that every worker and every person gets that. We are expanding unemployment insurance. As many of you know, the 7-day waiting period has been waived. So you can apply for unemployment the moment that you experience any sort of disruption to your income. And we will be continuing to push in making sure that we're also expanding Social Security, Medicare, and Medicaid as well. So these are all things that are top of mind for us right now. If there are any questions that you all have from a policy response level, I'm happy to field them. And we also have Noreen, who's on the call as well. And if you have any additional questions, please feel free to call my office with any other questions that you may not think of tonight.
We do have some questions from board members, so I'm going to unmute Fausto Rodriguez. Fausto, you're up.
Yes, I am. Hello, AOC. I have a question. We all know that we have a pandemic. We all know that the country is in a state of emergency.
Wait, hold on 1 second. We're getting some interference. I'm just trying to figure out who it is so that I can mute their line, okay? Got it. I'm muting him right now. Okay.
Should I say? Can you hear me?
Fausto, you're on.
Now, we have a pandemic. The nation is in a state of emergency. Mm-hmm. But what I'm finding so weird is that we have a whole bunch of radio stations, TV channels, you know, making the people crazy. I guess, you know, it's making the people sicker. Are you guys doing anything to control that?
Well, I think the one thing that's really important, and at least what I try to do every time I go on TV, every time I go on the radio, is that I tell people now is not the time to panic. now is the time to prepare. So it's about prepare, don't panic. There's no reason that you should have to panic. In fact, panicking can make things worse because when everyone is so on edge, of course, this thing is hitting during seasonal allergy season. So now anytime anyone has a cough or feels, a little stuffed, we all kind of are looking around and get a little scared. And so I think it's really important that we reiterate that it's not a time to panic. And in fact, again, it can make it worse because if you are sniffling or have a cough and run to the hospital at very mild symptoms, we're going to make the situation worse for everybody because we need to free up the hospitals for the doctors and nurses and healthcare providers so that they can treat people that are in critical condition. So I think it's really important, make sure that we're calm. If you are experiencing any sort of symptoms, monitor them. So if they are relatively mild, just wait a little bit and see, it could be a cold, it could be allergies, and call your doctor if you feel like they are getting worse. Remember, the symptoms are dry cough, their fever, and body aches. Those are some of the most common symptoms. If you're feeling that and you think it's getting bad, call your doctor and they can get you to a place to get the care that you need. But the safest place that you can be is your home. So make sure, and we all try to do our part. I'm doing my part in that every time I go in for an interview, I say, prepare, don't panic. That means have enough food in your house. It means sanitize your doorknobs and your light switches, but there's no need. The panic is not a productive emotion, even if you need help, because it'll freeze you up.
Thank you.
Okay, thank you, Fausto. Now I believe we're Nabaraj KC. You had a question?
Yes, sir. I have a question to EOC about, since I'm a businessman, and about our restaurant. It's a bar and restaurant right at the Jackson Heights, and technically it's closed. So in terms of the rent, no matter what, we have to pay to the landlord. So is there anything you're thinking about the rent for the business owner that's been closed according to the state law?
Yes. So as I said earlier, what we're pushing for. So first and foremost, mortgages have now been suspended in the state. Now we're pushing to make sure that rent is also suspended in the state for the next 90 days. The governor has called for has enacted the moratorium on mortgages, but has not yet enacted the moratorium on rent. But what that does mean, and what I recommend to you, is to talk to your landlord. If you are experiencing a rent issue, talk to your landlord and say, the state has issued a 90-day moratorium on mortgages. So the landlord can't tell you, right now a landlord can't tell you, you need to pay me rent because I need to pay the bank. Because right now landlords don't have to pay the bank. So talk to your landlord and ask them, ask him if there's something that you all can work out. If you want to know the details of it. So the details on the mortgage suspension is that it's not that every mortgage payment gets suspended immediately. If you like, we can forward the community board we can forward the community board information on the moratorium, but basically it's need-based. And so you are in need right now. The restaurants have been closed in the city. And so that, I would presume also means that your landlord would also be in need because he would lose a tenant otherwise. So definitely look into it, but there is a provision made. And if your landlord is getting a moratorium, then you should talk to them and ask them for a moratorium as well.
All right, thank you.
All right, thank you, Nabaraj. Now I'm gonna unmute Nuala O'Doherty, who has a question. Nuala, you're up. You have to unmute your line though, Nuala.
Hi, Congresswoman. I wanted to talk to you about the vulnerable and those who are sheltered in home. How can we best utilize the Postal Service? I think they know who the people are who are elderly or not leaving their homes who might need help. have a way that we could work with the Postal Service to find out who these people are and give them local people who might be able to help them?
That's an excellent idea. One of the things that we did a training on last night, we held a training on how to create a mutual aid network. So this is something that every single person tuning into the call, we can send you all the link to our training on it and the resource guide. So right now, federally and legislatively, we've introduced bills on things like postal banking and expanding essential services for the post office. But in the meantime, there are things we can do immediately in our community. And I think bringing in your local postal worker as part of your mutual aid network, so much of this change also starts from the bottom up. As much as the policy work and the coordination that we're doing from the top down, I cannot tell you how important you, Nuala, and everyone on this call is in making sure that we start building like a real on the ground understanding of our communities. So if you are listening right now, and you want to make sure that people in your community are taken care of, talk to your postal worker and just ask them. Say, hey, is there anyone that you know of that I should check up on my block? And I think we'll start there. But of course, we're trying to get postal workers the protection that they need right now, because they are all also kind of frontline vulnerable workers as well.
Thank you.
Okay, thank you, Nuala. The next one up is Lobsang Salaka. You have a question?
Yes, give me
Lobsang?
1 second. Yeah, give me 1 second.
Kevin?
Okay. Yes. So while we wait for
You hear me?
Lobsang,
Yeah.
are you there?
Yes, I am here.
Okay, ask your question.
Hello, Congresswoman. This is Lapsang again.
Hi, Lobsang.
I'm talking about the Uber driver and taxi drivers. They're not like employed, and they're not even like a small business. So I don't know what kind of assistance are available to them, because they are the most hardworking people, and there's tens of thousands of them in your district.
Yes.
And the other thing is the federal assistance. They are talking about says about just for citizens. So is that true? That's going to just the U.S. citizens, or can you clarify a little bit about what the Senate is talking about?
Yes, absolutely. So, so one of the things, and this is kind of what I was I alluded to this earlier, in that I'm trying to make sure that all of our federal policy also includes gig workers, hourly, contract workers, because this is where they put in all of these loopholes where they say, oh, we'll expand unemployment insurance. Or right now, for example, the state has paid leave for all workers, but it requires you to be an employer. And more recently, a lot of these big companies, whether it's Uber or whether it's, Shipt or Grubhub, they aren't calling their drivers employees. They're almost like independent contractors, as you know. And so that's why the bill right now that's being debated in the House and the Senate has to do with universal basic income. So we're trying to get cash assistance to everybody, no matter what you do, who you work for, or what your status is. So that's something. So if you essentially, I believe, and what we're fighting for, and it's coming together. So the package has not been finalized yet, but we are trying to make sure that we get cash assistance to workers, and that includes Uber drivers. Now, one thing that I can say is that if for whatever reason you haven't been able to work, I would again encourage folks to look at the unemployment insurance policies and to file if you are eligible. I think it's really important that everyone starts getting the help and applying for the help as quickly as they can.
Okay. Thank you, Lobsang. All right. This is a quick question from Bill Meehan regarding undocumented workers. I know we were just talking about taxi drivers and Uber drivers. Anything specific you want to mention about undocumented New Yorkers?
Yeah, so it's an excellent question. So first and foremost, we have secured a commitment from the administration that the public charge rule will be waived for undocumented members of our community. So you do not have to worry that, you know, if you are exhibiting symptoms and you go to the hospital and you use Medicare or Medicaid, you will not be subject to the public charge rule that is scaring people out of going to school and applying for assistance and things like that. You will be exempted from that. So our undocumented neighbors, we have been able to waive the public charge rule so that they will not be exposed to that. So please get the health care that you need if you are exhibiting symptoms of COVID-19. So that's one thing. The other thing that we're looking at too, when it comes to universal basic income, that I think we can flag is, you know, who gets those checks. You know, the idea is that it's everyone. So we're hoping that it's everyone with an EIT, that's, or a tax identification number. We're again, that legislation is still being drafted and it's in flux, but that's the perspective that we're championing.
Okay, thank you. We have a few more questions. If your question has already been asked, and I call your name, please just defer to the next questioner, because the Congresswoman's time is very valuable, as well as we have other speakers that are still, the doctor that still is finishing his Q&A, as well as other speakers tonight. So we're just gonna race through these real quick. MM, are you there to ask your question? MM, you have to unmute. Okay, we're gonna move on to Marjorie. Let me find you. Marjorie
Hi.
Clark.
Yes, I'm here. Hi, how are you? My question was about the use of SNAP benefits, that the feds were saying that they were going to limit that. And now in this situation, what's going to happen to people who need to file for SNAP?
Yes, so I'm so thankful that you asked that question. The House bill that we just passed, the second emergency package, should now expand SNAP. You are correct in that the Trump administration was trying to kick about 700,000 people off of SNAP, and you know, the fact that first of all, it was wrong in the first place, but the fact that this is happening when so many more people are in need is very wrong. So what we've been doing is that the latest package that we just passed expands SNAP and WIC. And it really makes sure that we are expanding food assistance for everybody. So that should be going into effect about immediately. We are still fighting that other rule and the other rule change that the administration is trying to go for, but I do believe that we'll be successful in pausing it.
Okay, and one last question from Laverne Nimmons. Laverne, you have to unmute.
Sorry, can you hear me?
Yes, we can hear you, Laverne.
Okay. Hi, OC. So glad that you're here and with us.
Of course.
Your presence is very, very much appreciated. Thank you. When will testing be extended to everyone, and what will that look like? Because you have people walking around, they don't know what's going on, whether they have it or not. They're afraid to visit family. I have family members calling me saying, "Don't come by until this is over." When will we be tested? Everyone needs to be tested.
So you're 100% right. We need to get mass testing out. We needed to get it out yesterday. We needed to get it out last week. We are working really hard on scaling up mass testing. The question, you know, frankly, a lot of this comes down to Trump. We have had other countries offer us tests. We've had other we've had the World Health Organization offer testing protocols. And so what happened was that the Trump administration did not take up those offers early enough. And they said, we can produce these tests here. And frankly, we can't, not fast enough, not when we needed them. So as a consequence, nationally, we have not had enough tests. And that's resulted in what you're seeing, in that kind of wealthy and powerful people seem to be able to access a test. Like if you're a sports star, you can get a test in, a day. But if you're an everyday person, oh, sorry. If you're sorry about that, if you're an everyday person that's needed help, it's been slower on the uptake. The good news, so first of all, Trump has kind of left the governors of every state to be on their own. The good news is that New York State, we are really working hard to ramp up the testing in the state, and we are testing more and more people every day. And so the good news is that the numbers are starting to really tick up on the tests right now in the state of New York. And we're working with our neighbors, with New Jersey, Pennsylvania, Connecticut, and making sure that everyone around us is getting their testing up soon. But we don't have an immediate timeline of when, you know, we can get to the level of South Korea, where if you need a test, you can get it immediately. I don't want to give you a false timeline, but what I can say is that we're starting to ramp up the tests more and more every single day. And we are setting up a testing and a treatment tent in Elmhurst Hospital that went up today. Right now it's by appointment only, but we are working to get to the point where you can just, you know, show up and get tested. So, you know, it's starting to get up, but you're right. The goal is mass testing. We started 10 steps behind a lot of other countries did, because we rejected a lot of testing protocols from other countries and from the World Health Organization. Not we, rather the administration did. And so we're trying to work through that challenge on a state level.
So once the tests are available, do you have a plan of how you're going to get them to the people?
Yes.
Is it
So
going to be drugstores, like they have testing for the flu now, or shots for the flu at all of the drugstores? Are there mobile units being set up? Are there what can we expect?
So what we have done in the House is that we have passed a provision saying that if you can get it, once the tests are available, they will be free. So no one will be able. No one will not have to take a test because they can't afford it. So when these tests are available, they will be free to you. Right now, they're going to roll out in a level that in which, like, first they'll be able to be administered from a health professional. So a nurse or a doctor or another healthcare or a physician's assistant would have to administer the test to you. Right now, there are some preliminary, you know, at-home tests that are being kind of tested out on. You know, hopefully we can get to a point where you can test yourself in your home. But right now, it looks like the path is going to be, if you're experiencing symptoms, you call your doctor, you show up, and you get tested, and that test will be for free.
Thank you.
You're welcome.
Okay, Renetta, I'm throwing it back to you.
All right, thank you so much, Congresswoman. We really appreciate you taking the time to speak to Queens Community Board number 3. As you know, we are really in a state of emergency right here, and we really appreciate you bringing your knowledge and the information.
Of course. Absolutely. Thank you all so much. Stay organized and stay safe, everybody.
Same thing to you.
Bye.
Thank you.
All right, everyone. We have another speaker is our Queensborough president. And we're trying to figure out which line she's on. Which line are you on? Borough President Lee? Are you on?
Capacity cut through it so that you can fall upon each other away from your eyes.
This Borough President. Kevin?
Yes, I'm here. I'm looking for her. I can't seem to find her.
I saw her listed under her name, but I don't see her there anymore.
You did? Where did you see her, Veronica?
I saw her listed as Sharon Lee, but I don't see her listed anymore.
Well, we're gonna text her.
Okay, so I'm gonna ask the doctor to come back so that we can continue questions for the doctor while we figure out where Ms. Lee is.
Yeah, because I was trying to see if we were still shared. Does everyone see this shared screen? Because I was trying to get rid of it so we could bring up the doctor.
I still have it. I have it still.
I was trying to remove it from there. So, but doctor, can you please ask the rest of the questions for the doctor?
Okay, so Edmund, you had a question.
Well, the question was, are there any plans to set up a mobile testing site anywhere within Jackson Heights, East Elmhurst, North Corona?
Yeah, can you hear me?
Yes.
Good. I think on the I don't know of any plan to do that. I think the testing site that we have at Elmhurst is meant to be used, you know, within some reasonable limits. I think it's very important that if you have no symptoms of this, coming to be tested to any site like that is going to potentially put you on a long line where you would be exposed to the public. And if you are testing negative, keep in mind that does not mean that you will be negative next week. I think as we roll out testing, it really should be concentrated on people who have at least mild symptoms or a known contact with a case. And I think as testing gets rolled out more and more, I think we're going to find that probably the majority of New Yorkers have actually been infected already. And whether that's going to amount to immunity, we're not going to know that yet. I don't think testing, if you're feeling well, really makes much sense, either medically or logistically right now.
All right. Do you have another question, Kevin?
The next one is Laverne.
And Kevin, if someone already asked the question on the list, can you choose a different person just in case? I know Laverne asked the question to the Congresswoman.
Right. Yeah, I'm sorry. Sometimes the questions don't come through. They just say they have questions, so it's hard for me to screen. I'm also just trying to keep track of everyone.
And
So
I do
Laverne,
have. How long do you think this mass quarantine or isolation of people generally is going to take place? What's your thinking on that, Doctor? Because this is really this is out of control.
I know. I think, though, we have to keep in mind that the whole outbreak is very, very likely to get worse for at least another month. Now, what that's going to mean in terms of advice to home quarantine, et cetera, I think we have to recognize we're in a very, very unique situation right now. We've never been in a situation like this in my lifetime, or I don't think in anybody's lifetime. We have a contagious disease that has a high mortality rate for which we have no vaccine and no treatment. We know it's transmitted from person to person, and I think the measures that are being taken, as I mentioned earlier, to close stadiums, et cetera, I think those are very important, but I don't think we can yet say when quarantining will no longer be necessary. I think you have to keep in mind there's a difference between quarantine. What that means is you're not known to be infected and you're staying away from other people, and isolation, which means you're known to be infected and you're told to stay in your home. Right now, they have not really, they have not exercised any kind of lockdown in New York City or New York State. But I think we just have to keep in mind that this is a very, very unusual and very serious problem that we're facing. And if you look at what's going on in Italy and now in other countries in Western Europe, we don't want to see that here, where an entire country is now on lockdown. We don't want to see that. So I think right now, let's do what we can do. Keep our distances, maintain reasonable cleanliness, make note of symptoms if we develop them. But right now, I don't think it's possible to say that we're going to be ending these measures anytime in the next week or two. It's just not possible right now, and I don't think it's at all likely that we will be.
So then it's not likely that school openings like in Long Island are supposed to begin on March 30th. So that's not likely to happen.
I think that's pretty ambitious. You know, I'm not responsible for the schools, thank God, but I think that's a pretty ambitious goal. I think maybe what a lot of organizations are doing is taking a wait and see attitude and seeing if over the next 2 weeks or over the next 1 month, things get worse like people are predicting, or if they don't get worse, and then maybe a change in the decision could be made. And I think that's why you're hearing these limited time frames, like 2 weeks, 3 weeks, a month. I'd be surprised if we're ready to open schools anywhere in 2 weeks if those schools are currently closed, because the epidemic is going to continue to spread. And I think the role of children in this, we talked about children a little earlier, and it is clear that at least older children have gotten infected. But what's of great concern with the schools, and this is true during flu season as well, is that children may not have symptoms and may be transmitting the infection among themselves and then bringing it home. So these are all complicated strategies. I think it's quite amazing what the government has done already, but I wouldn't be surprised if it continues longer than the next couple of weeks.
Thank you. Thank you,
Okay.
Doctor.
Thank you,
You're
Laverne. I'm gonna, Fausto Rodriguez, you had a question.
Doctor, what about during the first 3 to 7 days? If I have some symptoms, is there anything that I could go to the pharmacy and get to ameliorate the symptoms?
Well, no. I think if you have fever, it seems like it's safe to take Tylenol. We're not sure that it's safe to take Advil and that sort of drug, but it probably is. So you would do what you would normally do for those types of symptoms, just to relieve the symptoms. There's nothing you can go to the drugstore to get that would stop the infection, just like there's nothing that would stop influenza. If you had symptoms of that, you would go take medicines to relieve the symptoms. So I think that's the situation we're in with this. Now, you know, there's a lot of interest and emphasis right now on trying to identify medications. I showed you a list earlier that we're going to be looking at that maybe would be helpful to actually stop this viral infection, but we're not there yet.
Okay, thank you, Fausto. I'm gonna move on to Ladisla Perez. Ladisla, are you there? Ladisla, unmute.
Yes, I am. Yes,
There you
hi.
are. Okay, go ahead and ask your question.
Yes, he did answer my question that Giovanna added, but I didn't understand well the answer. And my question was, if you get immune to the virus, once you get it and you get cured, will you get immune? And my second part of the question was more likely for the Congresswoman, but you've been talking about it, that every gathering has been canceled, like in stadiums, any place that gather a lot of people is being, being closed, but they don't say nothing about churches. And I'm concerned about those small churches, Pentecostal church. There's a lot of Pentecostal church all over New York City where they gather 40, 50 people, and nobody has said anything about it. I'm sure they're going to get together. It concerns me because the more people get sick, the more chances you got to become sick by then too, by getting, close to them, which I try to stay away, but it's hard.
You're absolutely right. I think the St. Patrick's Cathedral, I think they announced this week, is not going to be having mass. And I think we're going to see that sort of strategy sweep through the religious communities. I think right now the state is recommending that groups any bigger than 10 or 15 people are dangerous. So it's hard to imagine that congregations are going to still be meeting. As I said, as you might imagine, I don't have any control over that, but common sense would tell you do not go to gatherings like that, because you're absolutely right. That could be a great fuel for this whole epidemic.
Okay, thank you, Ladisla. I'm going to throw this over to Philip Pappas. Are you there, Phil?
Yes, I am. Can you hear me?
Yes, go ahead and ask your question.
Hi, thanks so much. My wife and myself and a lot of people I know obviously are working from home this week and for the foreseeable future. So far so good. We're happy to have the technology to be able to do that and happy to stay in place. But we're also going a little stir crazy, so people are joking about it online. Our gyms have been closed and our memberships frozen. So just to sort of combat the stir crazy and try to stay healthy, we're not having symptoms, whatever. My question was, how safe is it if we have access, let's say, to a really open, empty block, there's no pedestrians, to just go for a walk or go for a jog if we're not really going to encounter other people?
That is absolutely safe, and I would encourage that. I think my wife, who's retired and is stuck at home, is having those same questions, and she likes to walk, she likes to run, and she's getting out and doing that. And I think you're right. If you're in an area where you can stay 6 feet at least from everybody else, and that's easy to do in many areas, absolutely you should get out of the house. Luckily, about the only good thing about all this is it didn't happen in the middle of winter with 10 feet of snow. It happens now as the temperature is getting warmer and it's going to be easier to get outside. So I think that is totally appropriate, and I would encourage that kind of thing.
Okay, thanks, Phil. Thanks, Phil. I'm going to throw it to Chanel Thomas, Henry. Chanel, are you there? Chanel, you have to unmute. Chanel, are you there?
Okay, thanks. Yes, I am. I think you had to unmute me.
Yeah,
Can you hear me?
Yes, we can hear you. Go ahead, ask your question.
All right. So it's a two-parter. When patients come to the hospital, what's the procedure in terms of contact? Are you guys or the Department of Health still contacting individuals that they may have come in contact with to put them on any type of quarantine?
Well, if a person comes and they have been shown to have this virus, the Department of Health is then responsible for contacting their contacts, their households, et cetera. As more and more people are identified as having the infection, that's going to become a more and more difficult process. But that's why we have a public health department. I think we have to be careful not to assume hospitals can do more than they're going to be doing anyway, just taking care of the very, very sick. But yes, I think all of us, though, have to recognize how large a problem this is in a city this big. And we have to do our best to understand what's going on around us and to help in identifying people who we think might have been exposed. But I do think that what we're going to find in the next couple of weeks is that as the number of very sick people rapidly rises and hospitals are increasingly busy taking care of them, that the entire issue of testing will have to be on the back burner somewhat. If you have symptoms and you need to be evaluated for those symptoms, particularly if you have shortness of breath, that is something that you should be seen for. But if you have cold symptoms, I think even if it is COVID-19, most people who have this recover from it nicely. You're better off staying home, staying away from other people, and not exposing other people. But we live in New York. There are people who may have 5 roommates. There are people who have no roommates. There are people who have young children in the house, people who are living with pregnant women. There are all kinds of scenarios, and we really do depend on our public health service in New York City and New York State to really help the hospitals with that contact tracing.
And then for those individuals who are hospitalized, are they able to still be in contact or visited by their family, or do they themselves become quarantined and isolated?
No, in the city hospital system, they've created a strict quarantine process for adults. For infants, there may be some flexibility in that. Obviously, it's really important for infants, but for adult patients, you should not visit. You should not expect it to be visited if you're a patient in the hospital. And that is all to protect the public from getting infected, if not by the person you're visiting, then by simply being in a ward where there may be other patients who are able to spread this infection. So that's a policy. It's part of the social distancing strategy that I think will ultimately be extremely important in New York and in the United States to keep us apart. And it's not always nice to not have visitors when you're in the hospital, but it's a sacrifice we're all going to have to make.
Thank you, Chanel. All right, I'm going to throw it to Richard Mullings, which I believe is one of the last few questions we got going here. Okay, Richard, are you there?
Kevin?
Yes, I'm here. Hello?
Wait, Richard. So Kevin, after Richard, we'll have 2 questions from the phone, and then we'll thank Elmer's Hospital, and then we'll go to our borough president, okay?
Okay. Go ahead, Richard.
Great. Thank you, Doctor, for the presentation. I have a question about the viruses staying in certain surfaces. So far, I heard that on plastic and on stainless steel, it could stay up to 3 days. In the air, it could be about 3 hours. Can you talk a little bit about the precautions we should take?
Yeah,
As far as like staying in?
Yeah, obviously in the hospital, this is of great concern, and it does seem like the virus can remain viable on surfaces for several hours. So cleaning of surfaces is extremely important. It doesn't have to be with any fancy cleaner. It isn't in the hospital and doesn't have to be at home. In terms of how long it lingers in the air, I think there are several different studies looking at this, and they estimate very, very different lengths of time for it to be in the air. Some, it's as few as a few seconds. That's why it's considered a droplet organism. But there are some studies that suggest it can be aerosolized somewhat longer. I think, though, when it gets aerosolized, so it lingers in the air for more than just a couple of minutes, that's not likely to be simply from someone coughing. It's from someone being suctioned in the hospital or being on a ventilator where they have to open the pore and the port rather and suction right out of the tube. I don't think it's going to be aerosolized in the air like that in a household. I don't. But surfaces we really have to be very cognizant of and careful about. They have to be cleaned.
Okay, so thank you, Doctor.
Thank you.
You're welcome.
Renetta wanted me to open the floor to some of the callers, the people that were calling in. So I'm gonna, which, so
first, the first
okay,
person.
so caller one, I'm gonna unmute some of the callers here. If you have questions, please ask them now.
Nancy. Oh,
Okay.
Go ahead.
Hello.
Yes, I can hear you.
Yeah, my question to Dr. Massey. Oh, this is Joyce Julian. My question to him is, has this hospital put in for any supplies from the Army Corps of Engineers, such as the ventilators and masks and things that they need?
Yeah, through the H&H Central Office, they are contracting with the Army Corps of Engineers and with other resources outside of our immediate area here. So yes, the city hospital system in New York, and I've worked with them on other outbreaks like this, they are extremely aggressive and very, very good at getting the equipment they need. So if it's available, they will get it. The concern is, will it be available? Do the manufacturers have to pick up the pace? Right now, it is available. For the next few weeks, we have plenty of it. After that, I have great faith in the city hospital system to get whatever we can get.
Question number two, I would like to also ask if there's a need for your hospital to have one of those treatment setups that they do. Would that be possible to put it? I mean, your location, where would you put it?
Yeah, we're working on several strategies to provide testing so that people wouldn't have to come through the emergency department. We've set up a small by appointment clinic for testing that you would be referred to if you called. There is also a limited capacity to handle people who walk in. I would really, really emphasize the point, though, to come to be tested if you're not feeling sick is liable to be a complete waste of time and could expose you to people who do have the virus. So please, before you seek testing, be sure that you have a reason to. You've been exposed to someone who is known to have it, for example, or you're getting symptoms that go beyond simple cold symptoms. We don't want to overload the testing capacity. It's been delicate to begin with. It'll expand eventually, but as I said a little while ago, I think a couple of weeks from now, we're going to be so absolutely consumed with taking care of people who actually are sick with this, that the capacity for hospitals to offer testing is not going to just expand and expand and expand. So be careful. I think you can get advice by going online. You can look at the CDC website. They have the on this. The city health department has, should you actually be tested. And I would refer you to those websites, and I listed a couple of them at the end of my lecture.
Thank you.
Reverend Peter Heron.
Okay, so that'll be the
Ellos
second
lo que
question.
quieren dar tiempo por la elección. Está bien de que hagan cualquier cosa, pero.
Okay, Pastor
Hello?
Ron. Go ahead, Pastor Ron.
Have you seen any patients or what is done for the homeless shelters or for those people who are on the streets? Have you seen any patients in those categories?
We have, and I think this is obviously a major, major concern. There are many, many homeless people in New York City, and they obviously cannot be sent back out to the street if they are sick, and we don't do that. But we are looking into, I know the city hospital system is looking into potential expansion of housing services for people in that condition. Obviously, it's never a good thing to have thousands of people who are homeless, as we do right now. So it is a struggle right now, and I can't pretend we have the ultimate answer to it. But it is something we're very aware of, and it's something we have a lot of experience with in the public hospitals in general, and certainly specifically at Elmhurst.
All right.
Thank you.
One more question.
One more question from the callers. Anyone?
All right,
Okay.
then. Thank you, Kevin.
All right.
Thank you so much, Dr. Massey. Thank you for a wonderful presentation, answering our questions. We will send out the presentation to the board members, anyone from the public, if they're interested. We will also, we'll post it on Twitter, Facebook, and on our website, the presentation. Thank you, Dr. Massey. Thank you, Mr. Rocha. Thank you, Atia Butler. Thank you, Elmhurst Hospital, and all you do for our community here.
Thank you for inviting us and me to give this presentation, and for the very, very good questions. We will keep you updated as we can. Thank you again.
Thank you so much.
Renetta, before we move on, thank you, doctor. But Renetta, before we move on, Jessica from the mayor's community affairs unit wanted just to mention something in regard to what the doctor was talking about. Jessica, are you there?
And Jessica has been wonderful, providing us with a lot of information, and we have to thank her for her hard work. She's working 24/7. I think she may have dropped. So I'm gonna end. She's still not ready.
She's still there. So while we wait for her, Zachariah Boyer from the Public Advocate's Office also had a comment that he wanted to make in regard to the doctor's presentation. Zach, are you there? Can you unmute your line?
Hi, I think I'm unmuted now. Can you hear me all right, Kevin?
Yes, we can hear you.
Okay. Hi, everybody. Thank you for having me on. This has been really great, and thank you very much to Elmhurst Hospital for doing such a fabulous job keeping us safe. And thank you, Dr. Massey, for saying everything. Just very quickly, the only thing I wanted to add is that our office is currently working on a faith hotline, and more details will be coming for those who are unable to leave their homes. We will be sending out information from the Public Advocate's Office on our social medias so that people can know when they can call in and which number to call for different religions, things like that. But that information will be coming slowly. As of right now, I do not have a number to give. I just wanted to say hello. I'm going to make sure I give my information to the community board members. I'm going to try to give you as much information as I can from my end. And just real quickly, I saw a question. Who's speaking? My name is Zachariah Boyer from the Public Advocate's Office. I'll put my email and number in the chat for people.
And Zachariah came to our last meeting in February, so thank you.
Hey, no problem.
Okay.
All right. Any other?
Jessica, are you there?
Yes, I am.
Okay, great.
So I just wanted to answer the earlier question about religious services. The mayor's office has been coordinating and communicating with faith leaders about religious service with the restrictions that have come on the federal level as well as the state level. Both the Archdiocese of New York and the Diocese of Brooklyn have canceled all masses. And so at this time, services are not being held, but religious institutions are open for individuals to come inside and pray.
All right, thank you, Jessica, and thank you for all the emails that you've been sending us. We really appreciate it.
Of course.
Thank you, Jessica.
So what we're going to do right now, while we wait for the president, we're going to ask Kevin to mute everyone, and we're going to have Edmund do the public hearing for our business Yeah, what you're gonna do is just recap. All right, so as normal, what you normally do. Okay, go ahead, go ahead, Edmund.
Okay, luckily we only have one applicant. First applicant and only applicant, Cositas Ricas Corp., 7919 Roosevelt Avenue, Jackson Heights. This is a corporate change. So just the basic outline is a family member is selling the remaining stock to the applicant, and the applicant will attain 100% ownership in the business. Are there any questions? We're taking questions now?
Does everyone, you should have received your report from the email that Ms. Reed sent, and then I followed up sending you a link to Google Drive with all the reports. Do you have any questions about the applicant?
I'm checking the chat. I'm checking the chat right now. No one has asked any questions via the chat. I can unmute the lines for the callers if they have any questions. Okay, so if you have a question and you have the capability to chat, please keep your line muted and just send me a message and I will call you. I'll call your name. If you are a caller, I'm going to unmute now so that the callers can ask questions of Edmund. Okay, so I'm going to unmute. Does anyone have any questions?
No question.
Me too, Mickey.
Oh.
If you don't have any questions, please don't say anything. If you only speak if you have a question. Okay, I think we're good. All right. So I'm gonna go back to mute. Just hold 1 second.
We have our two co-chairs here, Stephen Kohanek and Edward Kiernan. I know Edward Kiernan was at the meeting, and I know Steve wasn't, but so we'll let Ed present on it, and if Steve has anything additional to add, please add that. So please unmute both Steve and Edward Kiernan.
Okay, just give me a moment. I have to find them in the list. All right, Steve, you are unmuted. I'm moving up to Edward Kiernan right now. Edward, you're unmuted.
Okay, thank you. So we have an application for a newsstand, application number 527-2020. It's proposed to be on the northwest corner of 81st Street and Roosevelt Avenue, which is adjacent to the Citibank. It'll be on the 81st Street, not Roosevelt. And they plan to operate 12 hours a day, 10 a.m. to 10 p.m., standard newsstand. Do we have any questions?
All right, if you once again, if you have questions, please send them to me in the chat. Otherwise, I'm going to open up the lines for the callers. If you do not have a question, please don't say anything, okay?
And Kevin, before you open up, does Steve have any?
This will fit. Auntie and your mom called.
Are there any questions?
Made your dad walk around yet?
Right, Chanel, put your phone on mute.
Okay, I'm gonna mute everyone. Okay.
Steve, do you have any comments?
Hold on, I have to put Steve back on. Just give me 1 second. All right. Steve should be unmuted now.
Steve, do you have any comments to add? Okay, let's move on. All right, so everyone, we're going to open up the meeting by doing the Pledge of Allegiance. We're going into executive session. All right, everyone. I pledge of allegiance
Play allegiance to the flag of the United States of America and to the republic to which it stands, one nation under God, indivisible, with liberty and justice for all.
A motion to adopt today's agenda? Unmute everyone, Kev.
Okay, everyone's unmuted.
I call for a motion
Aye.
to adopt the agenda.
Aye.
Aye.
I call for a motion.
Second.
I make the motion.
Who was that?
Reverend Peter Heron.
Okay. Motion seconded by Kevin Husnaboa.
Yep, I second it.
Second.
Motions by committee, Ms. Deco.
All right. Edmund, do we have the business here?
No. None of the other.
Okay. Okay. I'm gonna mute all. Just give me one moment, Edmund, okay? Okay, Edmund, you're on.
Go back.
Yeah.
Okay. First and only applicant, Cositas Ricas Corp., 7919 Roosevelt Avenue, Jackson Heights, application for a corporate change. Motion is, committee recommends approval of an application for a corporate change of an on-premises full liquor license for this applicant, provided a stipulation has been signed stating their hours for operation will be 24 hours daily. Alcohol will be served from 12 p.m. to 4 a.m. Monday through Saturday, 10 a.m. to 4 a.m. on Sunday to facilitate Sunday brunch, and last call will be 3 a.m. daily to allow for beverages to be consumed by 4 a.m. Stipulation has been signed and received. Do I have a second?
Second.
Unmute everyone. Okay, Kevin.
Second.
And someone else, I don't know who said that.
I think Lisa.
Lisa Masillo seconded.
Okay, now any discussion?
Any-
Any discussion?
I've unmuted everyone.
Okay.
Does everyone have a report?
I muted everyone real quick. If you guys could mute your lines on your end, and then I will, when I unmute everyone, if you have something to say, then unmute on your end so that you can ask your question. That way we don't have all of the feedback from everybody's lines. So we'll do it from both ends. Okay. So if everyone can just mute on your own lines and only unmute if you have something to add or ask or, okay. So I'm going to unmute everyone.
And can you please say your name before you speak if you have any questions or comments about the application? Evan Wesley, you have something to say? Does anyone have any comments?
I have a question.
Go ahead.
Okay, this is Ed Wesley. We just met the Jackson Heights Beautification Group with the captain that's in charge, or half in charge, from the 115 of the Roosevelt Task Force. And we asked him, what are the...
If you're not, I'm sorry, if you're not talking, please mute your line. Go ahead, Ed.
Okay.
And we asked him, what are the 4 top priorities that he's concerned about in the neighborhood? The first thing he mentioned were the number of bars. Now, we all know well, we didn't know this for sure, but there are 240 bars within our community board. And obviously, many of them are on Roosevelt Avenue, and that's why they have a task force. But he says of that 240, there are only 4 bars that give them constant trouble. So he's being inventive. He's going to the health department. He's going to check their SLA authorization. If they say they're a restaurant, he makes sure that there's a chef on duty when they say they close. And as you know, I will not vote on any bar or restaurant that is open till 4 a.m. in the morning. That's not a restaurant, that's a bar. And we know what they're trying to do. So that's what I wanted to say, and I appreciate the time.
All right, so do you have a question on this applicant at all
Pertaining to the corporate change.
to the corporate change? All right, anyone else has a question? Do you have a question related to this particular applicant? The corporate change?
Okay, good. Anyone else have a question? Anyone else have a question regarding the corporate change? I guess I take that as a no. Call the question now.
Okay. So this is for Cosatias Ricas Corp. located at 7919 Roosevelt Avenue, Jackson Heights. Corporate change. The committee recommends approval of the application. So a yes vote is a yes. Ann Brown.
Yes.
Elba Buendia. Elba?
Yes.
Okay. Mr. Chowdhury. Mr. Chowdhury? Chowdhury, are you there?
Yeah, you have to unmute.
Everyone's unmuted.
No.
Mr. Chowdhury, is your vote a no?
Yes. No. No.
No. Okay. Heiko. Das. Sony Davis Roberts. Vivian Dock. Vivian, are you still with us? All right. Margaret Dossier.
Yes.
Renetta English.
Yes.
Mr. Gandhi. Mr. Gideon. Mr. Gideon, are you
Yes.
there? Okay. Pastor Peter Haran.
No.
Yes, I say yes.
Mr. Gideon, I got your vote. I got your vote as a yes, and Pastor Peter Haran, I got your vote as a no. Lorinda Hooks.
Okay.
Lorinda? Mr. Hollader. Mr. Hollader? Okay. Kevin Hughes Novoa, yes. Joyce Julian. Joyce, are you there? Joyce?
Yes.
Okay, is your vote a yes or a no?
Yes.
It's a yes. Okay. Nabaraj KC.
Yes.
Edward Kiernan.
Yes.
Stephen Kohenik. Stephen?
Yes.
Marta? Yes? Stephen, was that you?
Yes.
Okay. And your vote's a yes. Marta Leberton.
Yes.
No.
Carlos Andre Lopez. Bill Meehan.
Yes.
Sulam.
Yes.
Richard Mink. Ralph Moreno. Richard Mullings.
Yes.
Laverne Nimmons.
Yes.
Veronica Ing.
Yes.
Veronica? Okay.
Yes.
Dula O'Doherty.
Yes.
Philip Pappas.
Yes.
Esteban Peralta.
Yes.
Ladisla Perez.
Yes.
Dorothy Phelan.
Yes.
Megan Rockwell.
Yes.
Fausto Rodriguez.
Yes.
Jairo Rodriguez. Leoncio Romero.
Yes.
Tammy Rose.
Yes.
Edmund Rosenbaum.
Yes.
David Rosero.
Yes.
Lobsang Salaka.
Yes.
Jimmy Smith. Mr. Smith, are you still with us?
No.
Okay, Marlene Tapper. Okay. Frank Taylor.
Yes.
Frank, are you there?
Yes.
Is your
Yes.
vote a yes?
Yes.
Okay, great. Arthur Tyler. Arthur, are you still with us?
Are you still with us?
Chanel Thomas Henry.
Yes.
Arthur was gonna answer.
Pat Thorpe,
Arthur zoned out on us in some of the meetings. He's up now.
Emmett Wallace,
Yes.
Joy Washington Simon,
Yes.
Edwin Wesley.
No.
No. Okay, and if you've already voted, please mute your line. Is there anyone that did not vote, that I called and did not vote for any reason? You couldn't unmute the line fast enough? I'll leave it open for a second just to get your votes.
Thank you.
Okay, I think we're good, and it's 31 yes, 4 no.
So the motion is carried.
Motion carries.
All right, so our next is traffic and transportation. Mr. Ed here. So Ed, and his report is in your packet, everyone, so please take it out and review it. So go ahead, Ed.
Thank you. Let me just address Phil's question from before. He asked if there was any opposition from local brick and mortar businesses. The answer was no. There was no opposition stated. So the committee recommended approval of the application for the recommended approval of the application for the newsstand on the northwest corner of 81st Street and Roosevelt Avenue. And the motion is to approve.
Okay.
Any questions?
Need a second?
All right.
Any questions?
I second it.
Any questions?
Any questions?
Any questions? All right, Edward Kiernan, can you call for the question? Oh, sorry, Kevin, I took your job. Sorry, apologize.
That's all right. Are we ready to call the question?
Yes.
Okay, so this is for DCA application number 527-2020 ANWS. The committee recommends an approval of the application. So a yes vote is a yes. All right. All right, please unmute your lines now. And once you have voted, please go back onto mute, okay? Ann Brown.
Yes.
Alba Buendia.
Yes.
Mr. Chowdhury. Mr. Chowdhury?
Yes.
Is that a yes vote, Mr. Chowdhury?
Yes, vote.
Okay, please speak up so that I can hear everyone. Vivian Dock. I'm getting a lot of feedback from somebody. Margaret Dossier.
Yes.
Renetta English.
Yes, and I think Vivian's on the line. Vivian? All right, go ahead.
Yeah, I called her, but she didn't answer.
All right.
Okay. All right, Mr. Gideon. Mr. Gideon?
Yes.
Okay. Pastor Peter Haran.
Yes.
Mr. Hollader. Okay. Kevin Usnaboa, yes. Joyce Julian.
Yes.
Nabaraj KC.
Yes.
Edward Kiernan.
Yes.
Stephen Kohanek. Hold on 1 second. Sorry. Stephen Kohanek, could I get your
Steve? All right, go on.
Okay, give me 1 sec. need to put in my earbuds. Give me 1 sec. Okay, sorry about that, everyone. My earbuds died. Okay, so Stephen's not here to vote. Marta Labreton?
No.
No. Okay.
¿Cómo es el voto que no?
Bill Meehan? Bill, are you there?
Yes.
Okay. Lisa Masulam?
Yes.
Okay, Richard Mullings? Richard Mullings? Laverne Nimmons?
Yes.
Veronica Ing?
Yes.
Veronica, are you there?
Yes.
Veronica, was that you?
Yeah.
Okay, and your vote was a yes. Okay. Nuala O'Doherty?
Yes.
All right. Philip Pappas?
Yes.
Esteban Peralta?
Yes.
Ladisla Perez?
Yes. Yes.
Dorothy Phelan?
No.
Megan Rockwell?
Yes.
Oscar Rodriguez?
Yes.
Leoncio Romero?
Yes. A mí no.
Tammy Rose?
La licencia de delito. Yo lo vi, yo lo leí.
Okay. Okay, I'm sorry, hold on. I'm getting a lot of feedback. If you're not a board member, please mute your line. If you've already voted, please mute your line. Okay, I'm getting a lot of feedback. Tammy Rose?
Yes.
Edmund Rosenbaum?
Yes.
David Rosero?
Yes.
Lobsang Salaka?
Yes.
38-22 ¿dónde?
Please stop talking. I don't hear your name. Or just mute your line, please. Jimmy Smith? Jimmy Smith? Marlene Tapper? Frank Taylor?
Yes.
Arthur Tyler? Arthur, I see you there.
Arthur.
Yeah.
Arthur, what is your vote?
The meeting is so exciting, Arthur.
Janelle Thomas Henry?
Yes.
Oh, Lord.
Pat Thorpe? Hamlet Wallace?
Yes.
Troy Washington Simon?
Yes.
Edwin Wesley?
Yes.
Yes. Yes.
Okay, we have 32 yeses, 2 noes. The yeas
Kevin?
have it. Yes.
Did you catch Steve's vote in the chat?
Oh, he's
Steve Kohanic.
voting in the chat. Okay, hold on.
His audio wasn't working.
Thanks, Phil.
Okay, so I have Tammy is a yes and Steve is a no. Okay, let me just do that real quick.
Should I stand up?
¿Qué más dijo Villa?
Okay, so we have 32 yeses, 3 noes. The yeas have it. Okay, so I'm going to now go back onto mute. All right, Renetta?
All right. Can
All right,
everybody?
Hold on 1 second, Renetta. Hold on 1 second. Okay, Renetta, you're on.
Can you see us still, or does the camera look like it's?
Okay, now say your name. Now see if they got you.
Yes.
Don't keep touching.
We can't see you. Please, I need you all to mute your lines.
No. Okay. So, can you see me now? All right, everyone. So the last few days have been very interesting.
Okay. Hey, Kevin, it's Steve.
Steve,
okay.
I got
tried
you.
to vote.
You voted
I
no,
tried to
correct?
vote no on the last one, but the audio wasn't working.
I got your vote recorded. Thank you, Steve. I'm going to put you back on mute, okay?
All right,
Okay, thank
everyone. So the
Okay.
last few have been very interesting for me, and I know for many of us in East Elmhurst, Jackson Heights, and North Corona. No, I won't say that. Okay. And I'd like to thank everyone for using this new technology, our GoToMeeting. As you can see, there's a couple of kinks, but as long as we're going through the emergency, this is how we're going to use, this is how we're going to meet for our regular meeting and for our committee meetings. So please stick close to your emails, and through the mail, you'll get some information, or you'll get a phone call from the office. All right. So again, as it's mandated by Section 70 of the charter, this is the reason why we had to meet today, and I'm happy we were able to use this technology. As you can see from my report, there's a variety of things that we did last month, and going forward, things are definitely going to have to change. But I thank all of you for joining the call, for participating. I wish you all to stay healthy, keep in touch. You will be hearing from the Community Board 3 office. If there's any changes, please let me know. But again, thank you, everyone. Thank you for being on the line here today. Do you have any questions for me?
Social distance, everybody.
Yes, social distance, correct, Lobsang, social distance.
Welcome, Steve, back.
All right, so does anybody else have any questions? So
Let me,
thank you.
This is Laverne. I don't have any questions, but I would just like to thank you for this phenomenal event. It was really well done. And then kudos to you and to all of us board members. Great job, everyone. Great job.
All right, thank you, everyone.
Okay, clap it.
Okay, good night, everybody.
Bye.
Hasta la vista.
We're not done. We're not done.
Auto.
What do you mean we're not done?
No, look at your agenda.
It's done.
No, we're
Good
not.
night. Good
Here,
night.
good night.
Wait, we're not finished, everyone. Okay, look at your agenda. So we have a few reports. First, I'd like to call for the adoption of this month's minutes. I call for the motion for this month's minutes.
Okay, that's the right.
I call for the motion for the minutes from February for approval.
Aye.
I'll second that.
All in favor?
Aye.
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 Yes.
Aye.
Yes.
Aye.
Okay, so we'll have report. Martha, can you unmute your line?
I just unmuted Marta.
Marta, come on. Very good.
Okay, so the only item for the Parks Department was we had a meeting on Thursday, February 27th. We talked about Gorman Playground. It's a $4.6 million project from Councilmember Costa Constantinides. It's 30th Avenue between 84th and 85th Street. It's the play area. They went through adding some gates at 30th Avenue in the north entrance, fencing around the playground, planting, the same footprint as the existing play area. It will drain properly. They'll have safety surfaces, mats, padding. Currently, there are no programs in the park. The building that is there is used for maintenance. There are no pets in the park, in the playground, specifically dogs.
Who's there?
Mr. Gideon,
other-
please unmute your line. Go on, Marta.
The
Sorry.
the other parts of the park may allow dogs, but they need to be on a leash. They're gonna make sure there's benches and game tables and some new lighting. We talked about a possible permit to use the park for a meeting. That may come with a nominal fee. and the park does close at 9 o'clock. So we discussed it within the committee to support the project, so that what we are seeking tonight is a letter of approval. So the project can go to the next steps in the process, which is procurement and design, to choose the design firm. Once the Parks Department finishes these documents in November of 2020, approximately, construction would start in the fall of 2021 with the completion of 1 year, which would be in 2022. So I need a motion that for sending a letter of approval. And if I could get a second on that, and if everybody is in favor, then we
Second.
will send the letter of approval.
This is Kevin, I second. Everyone is unmuted to do the,
So if everyone is in favor of sending the letter, please say aye.
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 Aye. Thank you very much. The other item that I just want to address is that due to the situation we are living in currently, Flushing Meadow Corona Park is closed in terms of all their programs. The museum, the Hall of Science, the skating ring, the Al Order Center, everything is closed in the park. At this time, I have received emails from It's Your Parks and from parks around the city. Everything has stopped at this point. Everything was canceled from the April 26th Earth Day or Open Park Day to the event on April 24th. The tree pruning, the pruning project on March 21st was canceled as well. So everything is on hold at this time due to the emergency at hand. If you do go out to walk and everything, just practice your social distancing, try to stay active in whatever way possible, and just stay safe. And we will hopefully have a committee meeting to discuss the World's Fair Marina scoping, the design, and we may be using this technology for that committee meeting, and then we'll go on from there.
Martha, you will use technology for your meeting.
Okay, so that meeting will be next week on the 26th, and I believe it's at 7 o'clock, and that information will go out so that we could have a committee meeting regarding the World's Fair Marina and what they want to do. There was a scoping meeting, I believe, on March 5th, but we did ask them to come to us because we want to see what they're going to do specifically, and we'll go from there. So thank you, and everybody stay safe.
Yes, and I know that I serve as chair of the youth.
wait, hold on 1 second. Hold on, I'm gonna mute everyone, okay? Okay, Renetta, you're live.
Yes, I know I sit as chair of the Youth Services Planning Committee, and a number of our young people that are expecting to walk for graduation, a number of the ceremonies have been postponed. Please support those young people and tell them how wonderful they are, and explain as much as you can what we're going through with this emergency. And I know that things will get better, and this is going to be another chapter, but please, I know a lot of the young people are concerned and quite upset that they're not able to walk in graduation, not be able to participate in their sports, and so on and so forth. So please support those young people. All right, who's next? I think that's it, right? Ms. Reed.
But the meeting, okay.
Ms. Reed?
Okay. Good evening, everyone. We just wanted to,
No, I wish I could fix the camera.
okay. I just wanted to thank you all for participating with tonight's meeting. We will be conducting our committee meetings and full board meetings in this sort of forum for the near future. As we continue to use this process, I'm sure that people will become very comfortable in this forum. The other thing I wanted to wish those who have birthdays in the month of March, happy birthday. I know that Fausto Rodriguez,
Thank you.
Vivian Dock, Jimmy Smith, Steve Kohanic, no, it's February, are celebrating their birthday. So I also wanted to wish you all a happy birthday. We will be in touch. As you know, because of the current medical crisis we have, the community board will not have any face-to-face meetings, but you can speak with us via phone and via email. It's not because we will definitely miss you on a person-to-person basis, but we will continue our wonderful relationship through this crisis period. And once again, please stay safe and healthy, and please feel free to reach out to the community board by email and phone. Thank you. Have a wonderful evening.
Okay. Somebody's phone is acting up. All right. Vivian, are you on the line? Vivian?
Yes, I'm having problems with my phone though.
We can hear
you.
you.
Hear me?
Yes,
Can you hear me?
Yes, can you give a report?
Okay, I'll be brief. March 5th, we held our second meeting in Planning Community Board 3's Leon Von Holden Health Fair to be held June 13th. We discussed the flyer, permit, entertainment, refreshments, raffle donations. Our next meeting is scheduled for Wednesday, April 8th at 6:30 p.m.
And
Okay.
we will be using this technology for Vivian's meeting, and I just want to let everyone know a number of the health centers have been closed. So that's challenging right now, but we will hope when it's time for our health fair that the health center will be open, fully functioning. So that's all dependent upon that. But Vivian will be using this technology for her meeting along with Mark's meeting that's coming up. Any questions for Vivian? All right, I see a number.
I just put something in the chat for Vivian because she asked me last meeting, so she can. Oh, she can't see it because she's on the phone.
Say what it is, what you put in there, but you can't see.
Yeah, sorry. So just for Vivian, this is Philip speaking. I spoke to DOT about trying to do a helmet giveaway at the health fair, and they said that they're booked solid on that weekend, unfortunately. I did reach out to Bike New York about doing a Learn to Live class, and also to Second Story Pilates and Yoga about joining us. I didn't hear back from either one of those organizations. This was a couple of weeks ago, so I don't know for what reason they didn't get back to us right away, but obviously right now we might not hear back from them for a little bit. But I can send another email out. Hopefully things will start to calm down as June arrives. So I'll keep on it. I just want to let Vivian know I did reach out to them.
All righty then. So I know that, do we have any? We have a number of our legislators on. I see Cuban was on. Cuban, do you have anything to say?
Hi, everybody. Can you hear me?
Yes, I can.
Okay, great. Hi, good evening. So just want to let you know that we are currently our staff is currently working remotely, but we'll still continue to provide assistance by phone and email. So if you need assistance, please contact us at the number 718-803-6373 and leave us a voice message so we can get back to you as soon as possible. And you can also email us at DROM, DROMM @consult.nyc.gov, or you can also reach me at QYE@consult.nyc.gov. So hopefully we'll try our best to respond to you as soon as possible, and hope everybody's staying safe and healthy during this challenging time, and have a very good night and wonderful night. Thank you.
James, thank you, Cuban. James, I see you're on from the New York City Comptroller. Are you still there? James?
I might have to unmute him. Just let me find him real quick. Oh no, he's muted himself. So I sent him an unmute request. James?
Got it. Can you hear me now?
Yes.
Yes, go ahead.
Okay. Yeah, similar to what Kibben said, our office is closed. Everyone is working remotely. But if anyone wants to reach out, you can still reach out to me by email or by phone. I can write it in there if you don't have it. I know a bunch of you already do. I can say that we've done some predictions of what the cost of this outbreak, this COVID-19 outbreak, will be to the city. Our office is thinking that through the second quarter of the fiscal year, the next fiscal year, that the cost of the city will be about 3.2 billion in lost tax receipts, lost tax revenue. And the office is asking that some revisions be made to the budget, some spending cuts for some non-essential services that could total about 1.4 billion. And that would mean cuts to most city agencies, aside from Department of Health, of course. We're also advocating for some things to be done to help small businesses. Things
James,
like
this is Renetta. So in regards to cuts to city agencies, are you referring to also employees?
no, it's just cuts to certain programmings, things that where spending could be lessened. I can send you the link. I can put it into the comment section there if you want to read the specific press release.
Board office, please.
Sorry, say it one more time.
Email it to the board office.
Okay, yeah, no problem. I'll do that. Yeah, it's just saying that most of the agencies should cut the budget by about 4%, but it's not saying that people should lose their jobs.
Okay.
And like I said, we're advocating for a lot of things to happen to help small businesses. Things like making it so they don't have to give their sales tax to the city at the next filing, which is this month. And various forms of relief we're advocating for.
Yeah, because as you can look up and down our main thoroughways, Northern Boulevard, Astoria Boulevard, 37th Avenue, so many businesses are closed right now, so they're suffering greatly. As we see, everyone, the little people, we do churn this economy. So it's so challenging.
Absolutely.
All right, anything else, James?
That's all I want to say for now. But if you want to look at other things the office has stated, look at our website. The last 5 press releases have a lot of information. So please check out the New York City Comptroller website so you can see all the things that Scott has put out there recently.
All right.
But like I said, I'll put my info there and just reach out if you need anything at all. We can help you find it. We'll help you navigate the bureaucracy. Our Community Action Center is still open. I'll refer any cases you have to them so we can get any answers you need if you're stuck in any way.
All right, so Lily from Assemblyman Aubrey, I see you're on. Is that Lily? Mm-hmm. You want to unmute your line? All righty. Our borough president was having some problems getting on. Lisa, do you want to unmute your line and just say a few words of what she sent to us? Okay. Lisa?
She's there.
I know.
And so is Lily, but.
Okay. I think that's it, everyone. So any old business, new business, any new business, Ms. Reed? No. So as it was mentioned by Ms. Reed, Community Board 3 is open. You have our email address, you have our phone number, but there's no face-to-face in the office. This is the last meeting that I will be in the office. So anytime you'll see me, it will be from my home. So I wish everyone continued health. Please keep in touch. I look for my email. I'm very readily available by email or phone, so you can also reach out to me. And please take care of yourself and your family. And thank you so much. We end our meeting at 9:55 p.m. Have a wonderful evening, everyone.
Thank
Have
you.
a motion to adjourn.
Thank you.
Thank you.
Good
Hey,
night.
Kevin, hello. Hi.
Good night.
Oh,
Have a good evening.
Good night.
Hold on.
Hello.
Thank you.
Yeah,
Hold on.
go ahead.
Hi, it's Lily from Assemblyman Aubrey's office.
Okay, go ahead.
Just want to let everyone know we are open because we have a very small staff, but we are taking all of our, we're trying to assist via phone. So we're not having anyone come into the office. This was a really great meeting. I will let the Assemblyman know that it was successful, and everyone stay safe. Have a great night.
Thank you.
Can you hear me now?
Yes, go ahead.
Sound like Lisa. It's me, yes.
Yes, go ahead, Lisa.
Hi, everyone. I don't want to delay the meeting ending, but I just want to convey on behalf of the acting borough president, Sharon Lee, her kudos to Community Board 3 for being able to come through and pull together this telecommunication conference as swiftly, and I know it was not easy, and she recognizes your commitment and appreciates all the hard work that it took to get to this point, and we know that we're all working as a community, and we'll all try to keep each other safe and support one another. And to that, have a wonderful evening. And remember, this is not a specific nation. This is our nation, and we must take care of one another. Thank you all, and be safe.
All right. So thank you again, everyone. So I call for a motion to end our meeting at 9:57 p.m.
Second.
Second.
All in favor?
Aye.
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 Aye. Have a beautiful evening, everyone. And you will be able to find the link to the meeting on our website, Twitter, Facebook, and Instagram. So you can end the recording,
Okay. Thank you, everyone.
Kevin.